An honor for me to welcome all of you today to today's seminar titled Reform, Lessons for Urban Governance Futures from the Pandemic. It's an opportune moment to have this conversation, especially because we are just reaching the anniversary of March 24th when the lockdown was first announced in 2020. And I think without a doubt, the movement of India's workers from cities back to their home rural areas was perhaps the most important and emblematic of images of the impact of the lockdown on India. And what those images did was to bring home the centrality of the critical questions about India's urban future, about the nature of India's urbanization, its ability to provide an inclusive social protection architecture that responded to the needs of India's workers, its ability to ensure that the movement of people was enabled in a way that protected their rights and dignities, that cities were prepared for the futures that they confront. What we know from the lockdown is that none of this is true. Lessons we have to learn are important because if we don't, then the sufferings of millions of Indians will go to waste. It is in that context that this study gains particular relevance. The study aims to document specific vulnerabilities of urban poor in the context both of past pandemics as well as the experience of COVID-19 in order to craft specific urban planning recommendations to build greater resilience for cities in South Asia in general, but in India in particular. The intersection between urban planning and pandemics was researched under 5 key themes: public space, housing and slums, water, sanitation and hygiene, public health, including clinical care, and livelihoods and social protection. This is particularly important because I think one of the big challenges that policymaking in India confronts, and perhaps one of the reasons why the lockdown was planned or not planned as it was precisely because many of these issues are dealt with in silos, with relatively less space and opportunity for engagement and conversation across these different factors. But each one of these themes that we studied, from public spaces to housing and slums, to public health, livelihoods, and social protection, fundamentally impact the experience of urban and importantly are crucial to ensuring that rights and dignities of all citizens are protected. So it's crucial for us to be looking post the pandemic, especially at the city in an integrated fashion that cuts across these different aspects of public policy, all of which collectively impact the everyday experience of citizens and the experience and their ability, most importantly, to claim full citizenship as they move across the country in search of work. The current research was a rapid assessment conducted during the period September 2020 and January 2021. We are today we are in a crucial phase of the fight against the disease, and as we prepare to deal with the second phase, it is important for us to be able to ensure that we mitigate against the impact of socio and economic consequences dealing with the pandemic and are better prepared both for the next phase of handling COVID, but also for the future of pandemics. It's an absolute privilege for CPR to have had the opportunity to work closely with the UK government in conducting this study. We are very grateful for the support, but also I'd like to thank all our partners across the 11 cities where we did this study, and particularly on behalf of CPR to thank the Sci-Fi Initiative for taking it on to conduct this really crucial study at a time when when conducting the act of conducting research itself was thrown up in the air. How do you do research against the backdrop of lockdowns and the need to be able to ensure safety of all, both the subjects that are being researched as well as those that are being researched. So this is also a very important moment for us to recognize the challenges of doing research in the context of the lockdown and the ability of many of our colleagues here today who are going to present the findings of their research of showing resilience and doing needs to be done in moments of deep crisis. So thank you very much, all of you, for joining us today, and especially to all of our panelists. I will now request Mr. Gavin McGilvery, who is the Development Director, UK FCDO, the Foreign Commonwealth and Development Office in India. Gavin was previously head of DFID's office in Burma from January 2013 onwards, and prior to which he was leading the private sector department, Global Funds and Development Finance Institutions Department, and International Financial Institutions Department at the DFID's London office. Gavin, it's an absolute privilege for us to have had the opportunity, as I said, to partner with the FCDO. This is one of many partnerships that CPR has. So a real privilege and pleasure for CPR to meet you and to host you, and over to you for your opening remarks. Thank you.
Yamini, thank you, and good afternoon to you. Now, Yamini, you were billed in the program as making welcome remarks, instead of which, as is customary for you, you made some very substantive and perspicacious remarks, and I thank you for them. So the British Government Foreign and Commonwealth Development Office, the FCDO, and our South Asia Research Hub, we, Yamini, have been delighted to work with you and your colleagues on this, and I thank you for inviting me to join the distinguished panelists, the experts, and the team who did the study for this dissemination workshop, to look more closely at their findings, the recommendations of the study. Now, as you pointed, we're still in the pandemic. We hope the worst is behind us, but I think it's really commendable of my colleagues and of you to grasp this nettle while it's still alive, and seek to get ahead of the curve, to see what we can learn already and begin to plan for the future, and not wait until the pandemic has run its course. And Yamini, I think you largely said this, but the pandemic and its impact has been very different from most of the disasters and emergencies that the world has faced, because the coronavirus has not differentiated on the basis of geography or economic status. It's hit us all. My country, the United Kingdom, is battling, as is India, as are countries all over the world. And many of the standard protocols that we have for disaster risk management weren't designed and are not equipped to deal with such an ubiquitous challenge. But while the challenge has hit us all in a somewhat similar way, or at least its impact has not been equitable at all. And indeed, the first sentence of the report notes that the outbreak of coronavirus and the associated lockdowns have exacerbated pre-existing vulnerabilities of marginalized groups. And already the data is showing this. Already the data is showing that it's the informal sector that took the brunt. 3/4 of the jobs were lost in the informal sector. It's domestic workers, many of whom, of course, work in the informal sector, who've been most at risk at losing their jobs, who have lost their jobs. With the hospitals working overtime to deal with coronavirus, the patients of coronavirus, it has been pregnant women, it's been marginalized people who have found that their conditions haven't been addressed, and storing up problems for the future. In India, 1 million children who should have been vaccinated for other conditions have not been vaccinated. So we already know this in fact, it's almost common sense. We read this in the paper every day. The risk, of course, is that these will be exacerbated going forward. Just over a third of India's urban population live in slums. The government estimates that over the next 15 years, the urban population will increase from about 377 to 600 million people. So a huge increase in the number of people who are potentially vulnerable, unless we get things better now. Now is the chance to turn that surge of urbanization that is going to be one of the main things that's happening in India in the next few decades, to turn that surge of urbanization into a driver of prosperity, inclusive prosperity, rather than a driver of inclusive vulnerability. Now, you have my great friend and esteemed colleague Jagan Shah managing or orchestrating a panel later on. And one of the many things I've learned from Jagan is that historically, pandemics and other urban disasters have prompted radical changes in urban governance. So in London in 1665, we had the Great Plague, and then the following year we had the Great Fire. And those two events encouraged one of our visionary urban planners, Christopher Wren, to create a new plan for London, a plan that decongested the city. Later on, towards the end of the First World War, immediately after the Spanish flu, that prompted the development of new space standards for housing through what was called the Addison Act of 1919. And elsewhere, we've also seen how public health crises have fostered innovation in city management. For example, in the plague in Paris, the need to keep track of the plague led to the practice of giving unique numbers to each house, something of course that we take for granted today, but was prompted by the plague. And similarly, building standards were changed to create spacious and airy wings or extensions to buildings so that more rooms could receive sunlight and fresh air. So in a way, modern planning today is the result of a long evolution. From the Middle Ages onwards, it's been the biological and medical sciences that studied contamination and pollution, and linked with cramped rooms and lack of sanitation, and anti-plague measures, quarantine, and demolition of decrepit buildings are considered basic practices in urban management today. So what this study and what this conversation today is all about is how do we do that today? How do we understand the lessons that the pandemic has taught us, and how do we use these to improve the way we do things going forward? And the study, Yamini, as you pointed out, examines the key aspects of urban planning and governance. It takes stock of how each aspect has been impacted by the pandemic. It looks at the government response so far, and based on that, it draws recommendations that we hope will be actionable, that can inform further policy levels discussions amongst all of the actors present today, and I hope also between the government of India and my government of the United Kingdom. And I just picked up, I suppose, 3 recommendations from the study. The first that struck me was the need to implement measures to ensure that public transport is maintained even during a public health disaster. And one of the ways that that can be done is building on the emerging positive trends of non-motorized transport, of bicycling. And in the Ministry of Housing and Urban Affairs is already taking steps in this regard. It launched the Cycle for Change Challenge to increase awareness of cycling. And in collaboration with the Institute of Transport and Development Policy, is in the process of developing guidelines to scale up cycling infrastructure. And I should say that personally, as a long-time bicycle commuter, I personally particularly welcome these changes. Another of the recommendations of the study looks at the success of Delhi's Mohalla clinics in ensuring continuity of private care and laboratory services and accessible and affordable primary health care to the underserved population during coronavirus. And the study recommends strengthening of powers of local governments for assessing and leading the on-the-ground response. And then the last aspect I just like to pick out is the opportunity, I suppose, to update the legal framework for handling public health emergencies. The response to the pandemic was framed by at least a couple of acts. One was the Epidemic Act, and that stretches right back. The Epidemic Act was first passed in 1897. And then the Disasters Management Act of 2005. I mean, that's already 17 years old. Even more recently, India's National Disaster Management Plan of 2019 focuses mostly on disaster risks such as earthquakes, floods, river erosion, cyclones, tsunamis, droughts, landslides, and avalanches. There's relatively little reference in the National Disaster Management Plan to epidemics and disease outbreaks. So the study recommends strengthening the disaster risk reduction framework in India. And another good friend, I know Kamal Kishore, member of the NDMA, will be speaking shortly, and I'm sure he will have wise words to say on this. So I'd like to congratulate the research team at CPR for delivering this high quality piece of work and doing so very, very quickly, and for ensuring that the research findings in the study don't just stay and are put on the shelf, but are already being translated into policy dialogue, which is what we're doing today. So from research findings into policy dialogue, and the next stage, of course, is from policy dialogue into implementation. And I'm very glad that we have today representatives from two of the offices that are best placed to do that. From the NDMA, I've already mentioned Kamal Kishore, and from Niti Aayog, we have the Additional Secretary, Rajeswara Rao. And I know that they care about taking those next steps. The next steps of putting policy into action. And I imagine that that will be a strong focus of today's deliberations. And I'm really sorry that because of prior commitments, I'm not going to be able to stay with you today, this afternoon, and listen and learn from the discussion. But I do look forward to hearing about it afterwards from colleagues. Thank you again for inviting me to say a few words. I wish you very well indeed with today's discussions. Thank you.
Thank you. Thank you so much, Arvind. We appreciate your remarks. I would now like to invite Dasgupta to make a presentation, which will be followed by a panel discussion commenting on the presentation. Just to introduce Shubhagato and our panelists, Shubhagato Dasgupta is a senior fellow and director of the Scaling Cities Institutions of India initiative at CPR, the Sci-Fi initiative. His current research focuses on land, housing and planning, and water and sanitation in India and the world, with particular reference to flagship government programs and service delivery challenges in smaller cities. After Shubhagato's presentation, we are really privileged and honored to have with us two members, as Gavin said, two senior officers respond to the findings of the presentation. Mr. Kamal Kishore. Kamal Kishore is a member at the National Disaster Management Authority and has over 22 years of experience in disaster risk reduction, disaster mitigation, disaster preparedness, post-disaster recovery, reconstruction, and climate change adaptation at the local, national, and regional and global levels. Prior to joining the NDMA, he has worked with the United Nations Development Programme for nearly 13 years in New Delhi, Geneva, and New York, and assisted over 15 countries in putting in place institutional and legislative arrangements for disaster reduction at the national and subnational levels. We are also joined by Dr. K. Rajeswara Rao of the Indian Administrative Services. Dr. Rao belongs to the IAS Tripura cadre from the 1988 batch and is presently serving as Additional Secretary of the Niti Aayog. He is currently managing urban development and urban poverty alleviation, skill development, labor and employment verticals at the Niti Aayog. During the long span of 32 years, he has served in various capacities at the Ministry of Women and Child Development, Ministry of Processing, Ministry of Railway, Ministry of Health and Family Welfare, Ministry of Mines, among others. He's also worked with Tripura and Andhra Pradesh state governments on subjects of urban development, education, social development, etc. So it's an absolute privilege for us to have the opportunity to listen to both our very, very esteemed panelists responding to the findings from the study, as well, I'm sure, pushing us along to think better and harder about challenges that this study throws out, but also that the experience of the pandemic brings to us on what the future of urban governance should be like. So thank you very much to both of you for taking time from your schedules to join us, and over to you, Shubhagato, to give us a brief overview of the findings from the study.
Good afternoon, and thank you so much, Yamini. Thank you so much, Mr. Gavalre. I have an onerous task of taking you through an effort that owes its existence to a whole body of research from the past and a lot of initiative from a whole largish team, both at CPR and friends and colleagues working in the sector from both abroad and in India. We've benefited from their scholarship, from their from a whole bunch of research, and we've had discussions with lots of experts too in crafting this report. I will not be mentioning everyone by name, but it's quite a large task for us at the Sci-Fi and at CPR over the last couple of months. I just want to early on thank Anirban Ganguly, Sanjukta Roy, and Jagan, of course, Jagan Shah, of course, for their continuous inputs into the report, their their help and support in bringing it to what it is today. So we bring it reform, given that it talks about urban planning, and we look at what the lessons for urban governance futures are from the pandemic in first phase, let's say, in India. So.
Shubhagato, you want me to share?
That would not, that would, one second. Yeah, apologies for that. Essentially, the report itself has two parts. The first one, the main report, looks at both literature review of a historical account of pandemics and urban governance and policy evolution, and then puts together a set of 16 recommendations in three larger buckets. This is supported by another report, which is essentially seen to be an annexure to the main report, which looks at thematic literature review in more detail, looks at the primary research we've done, and looks at it in the context of South Asia more broadly. The study objectives itself was to look at issues around urban space planning, affordable housing, slum redevelopment, looking at public spaces and vulnerable populations, looking at the infrastructure gaps in both the health and the physical infrastructure sectors, and also look at livelihoods and mechanisms to improve social and economic safeguards for the community at large. This was to be seen in a historic perspective, but we were to look at primary research from the first phase of COVID, as I mentioned. The early urban and macro impact of the pandemic, as both Yamini and Mr. McGarvey have suggested, has been many, and there are lots of reports out there, both on terms of its economic consequences, but also its social consequences. And within that, the issue around slums and migrants have emerged to be very important too, with much higher risks and lower quality of infrastructure in slums, and the issues around not being able to connect with the larger working population through public programs. There have been lots of new initiatives, and the report will go through some of the key, very interesting and massive amount of work that local governments and national governments in India have done during this period. But before we go into that, just to back up for a bit and look at the long trajectory of how urban planning for most of human existence has been the core instrument through which protection against pandemics was kind of implemented. So in right through the early history to medieval times, right up to the 19th century, it was a whole set of planning instruments that were the first line of defense against pandemics. In the 19th and early 20th century, this effort was scaled up with the industrial revolution and new technologies. Urban areas saw new sewerage, new public health acts, lots of investment into public infrastructure, which mitigated much of the risks around cholera epidemics in the West, but was very geographically centered around particular parts of the world. In the 20th century and continuing to today, the discovery and the progress in clinical care and vaccinations have kind of pushed urban planning instruments into the background and have become the frontline solution for pandemics. And this is through the various pandemics that the world has witnessed in the recent past. This is very evident. The discoveries around these vaccinations have become more efficient, and the current one is surely quite amazing to see that in 12, 14 months, vaccination across the world has started. This is completely a new phenomenon in the long history of urban settlement. Pandemics ensured throughout the Middle Ages that the urban population never got above 10% of the global population. And now we are in dealing with a context of urbanization, which is more than 50% of the world's population. And we need to be both looking at clinical care and improvements, but also seeing what urban planning can bring in to prop up the fight against such kind of pandemics and disasters. So within that context, while this study looked at South Asia more broadly, much of the recommendations are related directly to India. And so we situated what is urban governance within the sectors we were looking at. And while there is more control over public spaces, water and sanitation and housing and slums by local governments, public health and clinical care and livelihoods, while there is an interface between local government and these sectors, they're widely have remained outside local control. Also, as both Yamini and Mr. McGrady have pointed out, that this has been just the first wave, right? So we've had to look at evidence coming out of early response and early recovery, and we've looked at measures that governments have taken, as well as what communities have been facing to make these suggestions for improving resilience as we go forward. More of this needs to be done as we see the rollout of this pandemic. In the methodology and structure, we of course started with secondary literature review, evolved a research methodology and conceptual framework, selected a set of cities for primary research, undertook a press scan to understand perceptions in urban areas around the pandemic. We created city profiles for each of the cities we were studying, and then undertook primary qualitative surveys on the ground across 11 cities before taking it to expert discussions to come up with the recommendations. The 11 cities that we worked on was a mix of both large cities and small cities, and are represented in the map here. Alongside this, in the city profiles, we also generated a set of maps to understand the infrastructure availability and densities in each of these cities. The press scan gave us an overview of what the key issues are as they emerge from the press. And through a multi-level set of keyword searches, a largish press scan was conducted across the global sphere, but also in South Asia in these 4 countries, India, Nepal, Bangladesh, and Myanmar, and in the 11 cities that we were surveying in. And what some key interesting facts from the press scan are presented in the next couple of slides. And as we see that public health and clinical care was the dominant issue in South Asia in the press, while in the global sphere, that as well as livelihoods and social protection had a more important division in the press. When we look at the specific sectors we studied, public spaces and housing and slums, for example, much of the global literature on housing and slums focused on social distancing, while in India, the main issue that emerged, not surprisingly, was the issues around housing and shelter for migrant workers. In public spaces too, social distancing was quite evenly the main covered aspect of both global and South Asia press literature. water sanitation and hygiene and public health also showed some interesting findings, where community efforts in India and South Asia were quite dominant. While they showed up in global press scan 2, it was a more equal share between that and sanitation. In public health and clinical care, of course, public health preparedness was by far the largest issue covered, but there was significant emphasis on frontline worker issues too. And finally, livelihood protection, daily wage workers and the issues they've faced was globally very significant, but even so in India and South Asia. Just a comparative assessment around how the actions of in India were represented both globally and in the Indian press kind of show us that while much of the literature was neutral, much of the press was reporting neutrally, there was a larger pessimistic perception in the global press than in India. When we then compared larger cities, out of the 11 cities that we looked at, versus the smaller cities, and we find that in larger cities, which were more directly at the edge of, face the brunt of this pandemic attack, much of the discussion was around public health preparedness in Delhi and in Bangalore, while in secondary cities like Bhubaneswar, there was more emphasis on public spaces and in livelihood protection. And in smaller cities, again, the coverage goes back into looking at public health preparedness to become the prominent issue. And as this next slide shows, is that the issue around livelihoods and social protection received much less emphasis in press reports in smaller towns than in larger cities, both in India and in international capitals. So building on the press scan and understanding what kinds of issues were emerging from each of these spaces, we conducted 156 key informant interviews across these 11 cities with government officials, with frontline workers, and community-based organizations. And we asked sub-questions of based on what we were looking at and where the pandemic originated, how it spread in the city, what the authorities did in response, and what it might mean for building back better. So, and the next couple of slides provide us with a little bit of understanding around what the key issues came out to be. And it's organized as evidence on the top and temporary measures that local governments have quite, to their credit, there is so much of activity that has been happening in each of these cities. It was very revealing and refreshing to see. So the issues, the first few issues are around wet markets, how open and green spaces were controlled, and this issue about intra and intercity transport that emerged to be a very big aspect. Wet markets per se have a very close connection to zoonotic viruses, not only from COVID-19 and its origin in the Wuhan market, but SARS, Ebola, all of these have recent pandemics have come out of wet markets. And while there is a government effort which was ongoing just before COVID too, some of that needs to be worked upon as we take this forward. On urban open and green spaces, to the understanding of how to control this was different in each city. There were different experiences, but a set of key issues did emerge around how unlocking could have better be served in these contexts. The transport issue came up to be the one of the most vital issues. The great migration that India saw, the reverse migration, the difficulties that frontline workers faced in providing, going to their places of work, have kind of pointed the direction that we need more motorized transport, as Ms. McGrevery said, but also that public transport might need to be seen as a service as in itself. And here is just as an example, the case of Bogota, where public transport, like most international cities, stopped through the pandemic. There were lots of changes done. There was social distancing implemented. There were monitoring mechanisms put in place, but it ran through lockdown. And alongside that, they took this opportunity to expand bicycling within the city by creating new infrastructure too. In the next set of issues that we look at, what has emerged very strongly has been the loss of livelihoods, because we don't have any business continuity funding in place. Another is, of course, health infrastructure expansion, which according to the policy does set out, national health policy sets out standards. We need to pursue them, relook at them, and pursue that track. And then the issue around strategic planning, especially in fragmented smaller city contexts where even when planning is done, it's not integrated with urban management. The next set of issues are around the non-negotiable aspects of labor laws. Of deep concern is the fact that many state governments diluted labor laws during this period to help the economy, but minimum guarantees need to be provided in the acts. We need to work, of course, on the unorganized sector social security, and more specifically on social security of street vendors. Rental housing emerged in housing policy in India in this bargain, because of COVID. However, much of it is private sector led, as is current policy. So there is a clear space for NGOs, CBOs, and the community itself to play a more active role in rental housing. And finally, slum upgrading has become has become indispensable in this time because of all the risks associated to water, sanitation, shared infrastructure, and congestion in these spaces. And here's the case of Orissa, which during this pandemic time created a new innovative model called the Urban Wage Employment Scheme that was used to build keep the contractor to use the in their own locations as a fourth tier of government through self-help groups and SDAs to create jobs in the community, but also to build their own infrastructure through slum upgrading of improved water supply, roads, electricity in slums, which has further led to delisting and creating more resilient cities in the bargain. And 500 slums out of their 3,000 slums are going to be delisted because their infrastructure has been built over the last few months. Another set of recommendations are around frontline workers, the fourth tier of governance, and the aspect that technology allows us to now include open governance, data-driven decision-making. And we should make the most out of it. Larger cities which have smart city centers did use it to some benefit. However, data is still a constraint, and we need to figure this out for the rest of the cities in India too. And another very interesting case of Johannesburg, which has used this as an integrated planning framework, which they have used during COVID times too, but has basically integrates all investments in an urban area through a common platform map, which allows both transparency and intergovernmental decision making. The final set of recommendations are around the legal framework and how it could support the rebuilding. And there is this debate around whether the health emergencies and prevention and pandemics control health framework should look at pandemics, or whether it's a disaster issue, given that it takes so long to come out of the pandemic. And here there are clear lessons that tell us that they need to be integrated as we take these forward. So essentially, these 16 recommendations fall into three large buckets, and which are the chapters in the report, which is about building urban resilience through integrated planning, which is about the next one is about eliminating the divide between formal and informal arrangements, and universalizing access in all our schemes and in planning. And then to look at what kind of governance scales and interfaces can be revisited through enabling legal reform to allow for smoother functioning as we move forward. So in conclusion, local governments, while we were in lockdown, local government staff, almost 70 to 80% of them were active even during lockdown and are today. There's been lots of new efforts at each level of government, which is super appreciable. But how do we learn from that to take it forward? We think that we have these three large recommendations, which could be the base for how we build back better. Thank you, Yamini.
Thank you, Shubha, for that presentation. And now invite Mr. Kamal Kishore to offer his remarks.
Thank you, Yami. Thanks for that. And Shubhagato, that was a great presentation, and the report draft that you shared earlier with me. And very timely also, I think, I hope we will be able to use some of your findings and inform the policy discourse within the systems of the government as well. So one can talk a lot about reflect the recommendations that you presented, but I will restrict myself to 7 big points. The first point that I want to make is I want to start by sounding a discordant note to what Gavin said, that the National Disaster Management Plan doesn't talk about pandemic and public health hazards. This is simply not true. It covers 17 hazards, and one of them is public health hazard as well. And it gets no more or no less coverage compared to, say, earthquakes. Having said that, whether it was sufficient, clearly not. Now we know that it was not sufficient because it never visualized the scale of the pandemic could happen, the scale of the impact across geography, across sectors, across different strata of society, different economic groups. That, of course, it did not anticipate to the same extent. And of course, it did not expect, it is generic and it doesn't talk about the specific virus that we talk about. So what I want to say on that point, I want to say is that there is a starting point there. There is a coverage of these issues in the disaster management plan of the country, but also there are guidelines there, which of course need to be revisited in light of what we've learned. I think so that's the first point. My second point is that one key thing that has become very evident, which is very relevant to the Disaster Management Act. So the Disaster Management Act in 2005 gave a structure, which is a 3-tier structure. So national level authority, then state authorities, and the district level authorities. And what is very clear is that, it is a huge omission that there is no conception of a city disaster management authority. So if a large city falls into 3 districts, basically there are 3 district disaster management authorities, sort of under the supervision of the state disaster management authority. That doesn't really work. So I think that is something which needs to be addressed. And also, the point is that there is a difference between urban and rural. So how the urban governance systems work, how the how it happens in rural areas. I think that differentiation in a rapidly urbanizing country, if it is not reflected in our national disaster management system, that's really something which needs to be corrected. The third point is that while the act itself is sort of multi-tiered with adequate emphasis at the local level, district level, and even at the level of below district, although there is no specific structure that the act identifies, it doesn't really talk about how the horizontal coordination will happen when multiple administrative units are affected. So, for example, there is much discussion about the movement of people who were displaced by the pandemic. So there are states that who need to basically facilitate for people to go home, and there are states who need to sort of receive people returning. How does that coordination happen? Whose responsibility it is? Which provisions of the law you use? What is the accountability framework for that? I think those of us who were in the thick of things and looking at it up close, the trains that took people home, there were huge challenges, which I can safely say that were largely unanticipated. So 90% of us did find a reliable way of getting home. But did we do that most efficiently, as efficiently as possible? Perhaps there is room for improvement there. The fourth point is that there are some parts in the country, the example which is cited again and again is Odisha, where we've been very successful in reducing mortality. And we can say that the disaster risk management system in Odisha works very well, much better than most parts of the world, at least cyclone-prone areas. And we've made remarkable progress in reducing mortality from cyclones. And we often talk about the contribution of improvements in early warning systems in doing that. But actually, that is indeed true. But a large part of that success is really community-based mechanisms. So the cyclone shelters that have been built on the coast of Odisha are not managed by the government. They are managed by communities. So these are multi-purpose shelters. A management committee manages these shelters. So when a cyclone occurs, you're not looking for where is the key to the cyclone shelter. It's already in use. There's a management committee. It's clean. It's usable. There's a process by which people move from their villages to the cyclone shelter and then de-evacuate. So the community-based dimension and having people's agency in disaster risk management is the key to that success. Now, how do we turn that? How do we apply the community-based mechanism in the urban setting? I don't think we have a full answer of that. I think especially where the social capital that people have, the sense of community that people have in the urban areas may be quite different from the rural areas. So the point there is the next generation of disaster risk management efforts have to really invent an urban model for community-based disaster risk management. And that includes not just formal urban spaces, but also peri-urban spaces, which may be officially not yet urban, but they have all the characteristics of urban. The fifth point I want to make is that in the law, there is a section, I forget what section it is, which basically calls for minimum standards of relief, which were issued, I believe, in 2016 or 17. Minimum standards of relief for people affected by disasters living in relief camps. Perhaps there is time to think beyond relief camps. The experience of the pandemic has taught us that people may not be relief camps, but they may be affected. And what are the standards we should apply when people have to be moved, when displacement of certain kind happens? So I think there is a need to look at the scope of minimum standards and then have some deliberation on what is it that would work. And in that process, I think it is very important to talk to people who are affected, who are more vulnerable, as to what is it that people want and what is it that would really work. It will not be feasible to simply import standards from another country and apply them here, because first of all, we may not have the wherewithal to actually implement those standards. And secondly, that may not be quite relevant for people themselves. The sixth point, and Shubhagato, in your presentation, you talked a lot about how the municipalities are working hard, etc., and you were appreciative of that. There is one dimension of it which we need to explore: the impact of an event like this on municipal finance. So it may not be so much of an issue for large cities, but secondary cities that have, the sources of revenue are from things as mundane as parking fees, or, from the tax they earn from, in a city like Shimla, if there are no tourists, the city is collecting no taxes from the hotels. So in a situation like this, and this is the pandemic will cover the whole country, if it is geographically focused, how would we address that? How do we sort of make sure that the municipal finances get the supplement? I think to some extent, the Finance Commission recommendations begin to address the issue of urban risk, but how far does it go? We need to see. My final point, and this is something, Shubhagato, you raised about where should the management of a pandemic-like situation rest in terms of legislative framework. Should it be a public health act, or should it be in disaster management act? In my view, I think it has to be in both. So there is sort of the specific domain of actually doing things which are specific to public health, pharmacological interventions, and so on, that of course have to be done through the health mechanism. But what pandemic has taught us is that, the risk is not confined. The risk ripples across sectors, across geographies. And the whole notion of systemic risk, if we have to address it in a systemic way, as opposed to, you have different silos of different hazards, from that perspective, I think the Disaster Management Act has to continue to play the role of managing risk as a whole. So in that sense, we may have had mixed experience of the application of the law, but it was a good thing that we had some legal instruments to do some of the things that we did. We could have done them better, but I think the instrument itself was there. Itself shows that somebody back in 2005 had foresight. There is comparative experience of the application of what legal instrument from other countries, and there are. It's not a struggle which has been unique to India. It has happened in other countries as well. There is, literature beginning to come out of that, which we can discuss later. Thank you very much, Yamini. Back to you.
Thank you very much for that. May I now request Dr. Rajeshwara Rao to please give his remarks.
Good afternoon, everyone. I'm Dheeraj Santadasani, joining in from Dr. Rajeshwara Rao's office. So at the moment, due to an urgent meeting, he's not able to join right now, but he said he may join towards the end of the program. So I believe we may proceed with the planned sessions, and as and when he comes, I'll let him.
Thank you. So then in that case, Shubhagato, let me turn this back to you to perhaps respond to some of the important issues Kamal raised, but specifically also on the issue of municipal finances. I don't think we've talked about this enough. We've spoken a lot in the public discourse on the impact of central finances, state finances, and not at all actually on municipal finances and panchayats too, whose, as your study also said, responsibilities expanded so significantly. So over to you, and then over to you and your team in terms of how to move the discussion forward to the next session.
Thanks, Yamini, and thank you so much, Kamal. It's always a pleasure to hear you. The deep understanding of the law and the sector of disaster management that you bring to the table is so valuable to these discussions. I mean, each of your points are highly appreciated. We will try and put them back into the report in case we miss them. We will relook at it. On the specific issue of urban finance, in one sense, it is around business continuity. So business continuity is social, economic, and urban governance, right? So, while I think our recommendation does not spend enough time talking about urban finance within that business continuity. We should do that, and we will. It's in a context where smaller cities anyway don't have robust finances. Larger cities are always at risk. Collections have been postponed, and in some cases, written off, so to say. So yes, it does bring us to a complex situation around urban finances. It's just a little in the day to get real numbers behind it, but we do have a sense from the ground as to what it will mean going forward. And on the Urban Finance Commission, means the Finance Commission adopting a urban risk framework is quite interesting, and we hope that that can bring in benefits to the sector. In my own opinion, I think it's a bit too tight. They're too deterministic about how to apply those funds. If that was left more to states and local bodies but the framework itself, of the risk framework itself, will be very interesting. And thank you so much for bringing in clarity on the legal framework and how you see it both in the international context and in India around the issue of pandemics, and how the Disaster Management Act has this systemic role to play too, in spite of having specific laws around health. With that, if Mr. Rao is not here, I would, unless Kamal, you have any other points to make, I'll hand it over to Partho in the next panel, to start the next panel.
Thanks, Shubhagato.
Yeah, all right. Thank you so much then. Partho.
Shubhagato,
yeah.
It's Jagan. The next panel is of Jagan's.
Oh, right. Sorry. Apologies. Thanks.
Thanks, Shubhagato. No problem at all. Let me start with congratulating the team. I mean, I think this, given the duration of the project from September till January, this is quite a remarkable amount of insight that has been gained. And thank you very much for inviting a number of key experts. I think Kamal has given us a lot of very key sort of insights on how the Disaster Management Act could be reinforced, but also how things operate on ground. I also just glimpsed at the participants in today's session, and I'm really happy to see that there are a number of senior experts from within the UK government, as well as Indian experts. Mr. Mark Harvey, who's the head of the infrastructure cadre, Sean Risdale, who leads the work on the research side, as well as old friends and experts, Banashri Banerjee, Kaustav from Priya, Srinivas Kauligi, Pushpa Pathak, Aparna Das. They're all here, so it's really wonderful to enter into this conversation. But most importantly, we have a very, very interesting panel to really bounce some ideas with. I think what I'd like to do is, before I introduce, just do a very quick section of what I picked up from Kamal's intervention, because I think that may just set the bar for our discussion. I think one key point that came across was the unanticipated nature of this, despite the fact that acts exist, despite the fact that governance at various tiers does exist. Why were we not able to anticipate such a situation arising? So situation awareness, planning for response seems to be a key need of the hour. As Gavin said, now is the chance. This is the right time for us to make sure that we often say build back better, make sure that our systems are functioning well. And very importantly, let's also not forget what Shubhagato pointed out in the presentation, that there is a long history of responses to pandemics. It has affected urban planning and governance for centuries now. So in some senses, if we don't do it now, then when will we actually act? In the Indian context, in 1946, the Boer Committee, which was the first committee that actually looked at public health issues along with urban planning issues, is a fundamental sort of document to look at. It recommended a complete revamp of urban planning before the year before independence. And if we go further back, and if you're at all familiar with the works of Frederick Engels, in 1836, he wrote a book, The Condition of the Working Class in England. And there's a wonderful chapter in that called The Big Cities, I think the Great Cities perhaps, in which the conditions he describes of London are horrifying. So if we think that conditions in our slums in India are problematic, do think back that societies had much worse conditions existing and came out of it. So there is a feeling that one can transform things. From Kamal's interventions also, I think the point about reworking manuals, I mean, relief manuals, to the best of my knowledge, have been basically created for famine and drought situations. So the bouquet of benefits, doesn't simply respond to these kinds of urban disasters, one might call them. The fact that we cannot import standards, that's a very important point we should keep in mind. Systemic response. So as we have this panel discussion, I think we should keep all of these things in mind. And last but not least, because we have a GIS expert on the panel, the fact that the Johannesburg response was, and I think Shubhagato, you could add that to your presentation slide, was really informed through the work of a wonderful institution called the Gauteng Urban Observatory, which actually looks at the whole region around Johannesburg. It's an independent body that collects data, geospatial data, maps it, creates the decision support systems that actually help cities like Johannesburg respond. And the use of integrated command and control centers in our cities, some of the smart cities, might be a good beginning, but clearly has to be informed by a much more complex understanding of urban disasters. So with that sort of set of issues that we need to grapple with, let me very quickly also introduce our panel, which is an illustrious panel of experts. I think we are very, very happy that we have Mr. Gotham Chatterjee with us. He is a retired officer of the Indian Administrative Service, has served for over 33 years in the government of Maharashtra, and very importantly, one of the few administrative officers from the service that has spent decades dealing with urban situations. He was formerly the chairperson of the Maharashtra Real Estate Regulatory Authority. He has been the principal secretary of the Maharashtra Housing Department, additional municipal commissioner of Mumbai Municipal Corporation, CEO of the Maharashtra Housing and Area Development Authority, CEO of the Slum Redevelopment Authority, the Slum Rehabilitation Authority, which is actually a pioneering effort in India, and also OSD to the Dharavi redevelopment project. So we could not have a practitioner with a deeper understanding of the kinds of issues that we're dealing with today. After Mr. Gotham Chatterjee, I'd like to introduce the second panelist, Ms. Shilpa Kumar. She's a partner at Omidyar Network India. She's an alumnus of the Indian Institute of Management, Kolkata, and she leads the strategy and investments of the Omidyar Network in areas of digital ID, governance, citizen engagement, and property rights. She has spent more than 30 years with the ICICI Bank Group prior to joining the Omidyar Network, and has deep understanding of financial markets, global markets as well, and has held board positions in ICICI Securities as well as Home Finance. She has served on regulatory committees and prominent industry bodies, and has also been on advisory committees of the National Stock Exchange, the Bombay Stock Exchange, and the National Securities Depository Limited. Our fourth panelist is Dr. PSN Rao. He is director of the School of Planning and Architecture in New Delhi. He is the founder chairman of the National Association of Realtors of India. So clearly, probably some things that he and Mr. Chatterjee can share. Over 25 years of experience, he has occupied positions in academia. He has been a consultant, a policy advocate, and an industry advisor across real estate, housing, and urban development sectors. He trained as an architect and civil engineer and also a town planner. He has received the SPA Gold Medal. He's also received the Best Citizens Award, the Shiksha Ratan Puraskar, the Indian Buildings Congress Medal, and the AICTE Young Teachers Award earlier in his career. And our fourth panelist is Mohammad Monis Khan. Welcome, Monis. We've been colleagues before. Head of the Urban and Regional Information System at the Town and Country Planning Organization of India. He has over 16 years of experience in overseeing multiple local and national schemes in the fields of urban and regional development, government, and also in the private sector. He's an expert in the use of the state-of-art technologies such as GIS and remote sensing, and he has degrees in planning from School of Planning and Architecture and a geography and a degree in geography from Jamia Millia Islamia. So I welcome all of the panelists. Thank you very much for joining us, and let us dive into a live discussion on the issues that have been thrown up by this very, very insightful study. Just to warm up, may I ask everyone, each one of the panelists, to very quickly, within say about a minute or 2 minutes, share with us one key finding from this study that Shubhagato presented that you think can lead to action where action is required. Can I start with Mr. Chatterjee, please?
Yeah, thanks, Jagan. And let me compliment the team for an excellent report, and specifically Shubhagato for presenting the report so lucidly. On this context of integrated urban planning and things that need to be done, especially after post-pandemic, what we have seen and the approaches by various central state or the city governments. The issues of looking at spatial planning and providing spaces for affordable housing and affordable workspaces for the vulnerable is something that needs to be looked at, and that has to be looked from the perspective of the master plan, I believe. So should I continue with my...
No, thank you. I'll come back to you.
Thank you.
Just very quick thoughts. Shilpa, can I turn to you now? A quick thought about what could be an actionable finding from this study.
Yeah, so I'd go with, community and community engagement and the last mile level of governance. I think what we saw is that communities and the last mile governance areas where people were already in practice. So in peacetime itself, they had gotten, measures going. Those communities and those, local bodies were able to respond the best and fastest. And therefore, there's no, a second option, but to have citizens much more engaged in their own lives.
Thanks, Shilpa. Dr. Rao. Dr. Rao, are you with us?
Jagan, I don't see Dr. Rao here, and we
Okay.
are trying to reach to him. So if you continue,
Okay.
I'll keep you posted on.
Sure, we'll continue. Monis, over to you.
Yeah, good afternoon. Am I audible?
Yes, you are.
Thank you. Very congratulations to Shubhagato Da. Such a wonderful study. I was just going through the brief which I have received through email. I was having the feeling that the coverage of these 11 cities. I mean, it should be little bit more. Maybe in the next phases you will come with some more cities. But the 11 cities, I mean, it doesn't seem to be much sufficient. I think it is a primary research. Maybe in the secondary phases, you may come with some more cities.
Thanks, Monis. I'm sure the CPR will look at continuing this research and expanding the scope of this research. Let me come back to Mr. Chatterjee. Mr. Chatterjee, please share with us your reflections on the findings of the study, especially reflecting on the integrated urban planning dimension of the implications of the study. Thank you.
Thank you, Jagan. Talking about integrated urban planning, basically we are talking about a planning approach that must have spatial, physical, social economic planning as its cornerstones. But obviously with issues like inclusiveness, governance, ecology, and also maintaining the unique identity of respective cities, with the planning having flexibility to ensure future readiness, because that is which will be most important when we talk about resilience. However, all these things that we talk about can only be done at the master planning stage. So when we talk about urban India, we all know that we crossed the 285 million mark way back. 2030, we are expected to reach 40%, maybe 52% by 2050. Now, in 2012, when the then ministry had a technical group to study the urban housing shortage, that was estimated that in 2012 to 2020, the total number of households which will be living in housing poverty, inadequate housing or no housing, will be around 18.78 million. 6% was in the LIG and the EWS category. Now, a recent study by the International Economic Relations research paper of the Indian Council for Research on International Economic Relations says it's about 29 million now when we talk about in 2018. Now, traditionally, the governments, especially the local governments, have had policies, and their implementation has only created a situation in all our cities, be it mega cities or all the tier 2, tier 3 cities, which I often call as a situation which is of a paradox of 3 A's. We are looking at something where we will achieve housing solution with affordability, availability, and acceptability. However, what we see is what is acceptable to the formal standards, that is the formal development control regulations and all. They are available in plenty. They are acceptable and also available, but they are just not affordable to the majority of the community. Now, you can see that, especially in mega cities, that hundreds of thousands of unsold inventories of apartments lying. And at the same time, we say that affordable housing is not available. Secondly, what is affordable and also again available in plenty in the form of informal slums, water settlements, is just not acceptable to the formal dispensation. And what the problem is that what could be acceptable and also affordable is just not available. And that's what is the challenge, and it continues to be. So we have had this growth of unauthorized, non-acceptable slum settlements, averaging maybe 33%, going up to 50% in Mumbai. And if we just look briefly at the reasons as to why this is continuing to happen, even in the tier 2, tier 3 cities, the newly coming up cities, is unaffordable housing due to rising land and construction cost, which has come out of scarce land and eschewed spatial development. We have experts who are claiming, and who claim, and rightly so, that state-owned government parastatals and government entities, they own large chunks of unused land, which can certainly be released for affordable housing. We have formal private developers who say that we cannot do affordable housing because we are unable to strike a balance between costs, and costs include the transaction costs and also rent-seeking behavior that is very common. And the costs include lengthy approval processes and the returns that they would expect out of the money that they put in. And as a result, we have that incapable or inefficient state parastatals, housing boards, development authorities, they attempt to bridge this supply-demand gap. But then collectively, putting together all these housing boards, they may be delivering maybe 1% of what the cities need. Even the large affordable housing projects, which in the PPP mode recently have been coming up, they are ending up in the isolated peripheries of the city, which lack connectivity or trunk infrastructure, and also away from employment opportunities. We have a rent control regime still in place, which curtail new investment in rental housing sector. And the fifth is, of course, the lack of reliable income documentation, which deprives low-income segments from formal institutional credit. Now then, what is the way ahead? The way ahead is, of course, integrated urban planning, and that has to happen at the master planning stage. However, we have often seen that discussions, when we are doing discussions regarding cities and urbanization, we tend to be concentrating more on urban governance, and thereby we sideline the aspects of planning or the master planning for the city. A well conceptualized and a detailed plan will facilitate effective governance. These 20-year master plans or development plans, as they are called in our part of the state, they set out a spatial framework of the city for the development, for the delivery of sustainable development, enhanced quality of life for its citizens. Their objectives, of course, are to boost the city's economy, to create employment, to provide a proper environment, a decent quality of life, and render the city as equitable as possible. But then it's needless to say that all this effort in planning and master planning will require the requisite planning capacity, which has to be created in the said local urban governments. Now, among the most important planning deficits, apart from a very long time period that actually goes into finalizing these master plans, is the issue of equity that has largely been ignored in city plans. The development plans or the master plans show severe lack of poverty planning. Planners are reluctant to recognize the issue of urban poverty or of finding adequate space for the urban poor to live and earn their livelihood. So Indian cities have not planned at all for affordable housing or affordable workspaces, leaving this aspect largely to the market. It's only recently that we have the Street Vendors Protection Act of 2014, which has obligated the urban local bodies to look at this part of the informal economy and make it a planned activity. Planning statutes, unfortunately, have still not sufficiently, they have not reacted to these mandated functions. Now, apart from the flaws itself in the planning, the plan operationalization and the implementation on ground has also been very poor. Generally, it has been seen in the context of Maharashtra that they have never crossed maybe 20% mark. And therefore, the time for the country to engage in a serious debate on the also size of the city and their impact on the overall livability. We have seen that these mega cities, Mumbai, Delhi, and the big cities, they fail abysmally on the benchmark of equity. The massive rise in the land costs, they put decent housing and basic services beyond the reach of the poor. And therefore, there is a strong case to strategize nationally in favor of decentralized urbanization. The housing policy also needs to work in tandem with this planned urbanization program. We have seen that there's a trend of de-urbanization of formal manufacturing in India, by which cheap land or cheap labor and all the other forces that are attracting formal manufacturing, suburban or to the rural areas. This model of expansion in formal manufacturing, clubbed with viable affordable housing projects, which will be predominantly rental, must be at the core of proposed affordable housing policies. To give a small example, if the MIDC, the Maharashtra Industrial Development Corporation, is planning industrial townships or manufacturing hubs, it has to work in tandem with the Maharashtra Housing Development Authority, so that at least that will come up, that the things will come up together, where the rental housing also will take care of the affordable housing needs of the people who will work in that industrial city. The government's PMAY program with 4 verticals expanded as a fallout of the COVID pandemic, and also brought in the 5th vertical of the affordable rental housing complex. However, I feel that in order to make this scheme attractive for the private sector to also participate in a big way into this affordable rental housing complex scheme, it will require more clarity on who does the identification of the targeted households, how do we scale up the construction, how do we manage the operation and management of these constructed complexes. These are very, very critical, and they need to be resolved upfront when we are talking about scaling up and having these affordable rental housing complexes. This also reminds me that the role of NGOs and CBOs will certainly become necessary. Maybe we can also use the learnings from the Odisha model. Therefore, in conclusion, I feel that there will also be some need for out-of-box thinking. These standalone housing programs and projects both in the ownership category and in the rental category, which the government is coming up with, may not be the best housing solution for low-income households. We have this problem of congestion, and the issue of congestion can be addressed by maybe constructing one more self-contained room in ownership houses, which can then be used for renting out. This is what I'm suggesting, some sort of a merger of the ownership and the rental schemes. And this, again, is sort of a learning from the informal sector. You will observe that most of the slum structures, especially I have seen in Dharavi, will have an attempt to create a mezzanine floor. And the mezzanine floor is something which is obviously given out on rent. So the rental housing in this informal sector provides housing solution to a large majority of the people. We need to learn from that. We need to have this sort of a merger of our ownership and rental schemes so that we can scale up in order to reach the millions of people that need to be reached. Thank you. I'll stop here for now.
Thank you, Mr. Chatterjee. That's I think, a very rich sort of presentation of the complex problems that I mentioned earlier, and thank you very much for doing that. I would like to come back to you with a question on the urban planning side, but let me move to Shilpa now. Shilpa, if I can just ask you, in fact, to follow up on what Mr. Chatterjee has laid out as being some of the challenges which actually pertain to community involvement in actually finding the solutions. And you are, in a sense, in the business of finding solutions and providing resources so there can be a larger community of innovators that can create solutions. I'd like to address a question to you with regard to community level planning, which contributes to the larger planning effort at the city level, because one of the gaps that I think, and a number of experts have found, is that one can plan, but then how does one provide the financial resources that allows you to execute the plan? Does the private and can state systems for delivery actually work with the private sector to address this challenge? Over to you, Shilpa.
Thanks, Jagan. Really would like to actually follow on from what Mr. Chatterjee was saying, and he talked about equity. I think the pandemic, to me, it really highlighted the fact that cities are really, dense labor markets. And it highlighted the fact that, we probably don't even know sufficient information about these dense labor markets to be able to plan for them. And also the reflection, I think that in the end, the cities are a continuum. And therefore, with the pandemic, we saw not only an economic crisis, but we saw a humanitarian crisis, and both because of the fact that there is this dense labor market, which suffers from a double informality. And a double informality, both in terms of, I guess, the livelihood part, but that informality then extending to actually the living conditions. People often say in response to Mr. Chatterjee's 3 A's, there are the 3 D's associated with this informality of, being dirty, difficult, dangerous work, and kind of translating into, therefore, dirty, difficult, and dangerous living conditions. And I think that then becomes really, the most central point of a pandemic like this. And while much has been said about, the need for integrated planning, I just have one comment which I'd like to put up front is, when you think of growth for the country, and you even think, whether you think equity or whether you think growth, I think the fact that as you look at cities, they need to be drivers of growth, not the results of growth, which we are all trying to cope with, what it means. And therefore, to actually maybe as we start thinking about, more and smaller cities, to think about these integrated cities, which have somewhat of a vision in terms of, the kind of living conditions that would be enabled for the citizens. And I think, for example, the pharma city that Telangana is doing, to actually think about what will take a city to a certain skill level, certain, economic level, and therefore, what are the conditions of, planning such a city. And I do think if we have, let's say, one city, which becomes a lighthouse project of its kind, I think it can really show the way, for integrated city planning, because otherwise, like, Mr. Chatterjee said, these are long lead cycles to actually getting these things done. But flipping, to your point on what is it that investors and foundations can do, especially in terms of, the community angle, the last mile angle. I think one thing that's, really exciting at this point in time is that technology is a great enabler of sorts. And I think the first thing I'd like to say is, a lot of urban local bodies have actually gone out and have implemented or are implementing tech backbones of their own. Now, that's not a magic wand, but at least it's the first step towards actually transparently being able to monitor and pick up various aspects of city governance. So I think, that's like the first enabler, which I feel really very positive about. I think the second enabler is that, once you have a lot of things which are digital, you can also then look for many different kinds of, again, out-of-box thinking that Mr. Chatterjee spoke about. And I want to share an example with you. For example, in IISC, you have a project called the UIDX project, which is really the urban kind of data exchange, an open data exchange, which is attempting to bring non-personal data of very many cities together, in a sense, offering this up for entrepreneurs to come and innovate on top of it. Now, one might argue, is this not the government's job, and why should, entrepreneurs get into it? And I feel like, if you see technology and entrepreneurship, they have changed the face of very many different kinds of services like education and financial inclusion. And I feel like the same can happen maybe even in civic tech. And if you think, for example, one of the use cases I saw at IUDX was the use of local transport. So Surat, I think there was an experiment that entrepreneur was trying to say that, can you at least give information on mobile about when a bus is expected, when public transport, whether it's full, not full, is there place available, in a sense, improving the quality of living by using data that is already available. So I thought that was the second thing. The third thing is, you talked about geospatial, and I for one, feel like, geospatial is a big game changer for governance and for communities looking for access to services. And we've seen some wonderful work, for example, done by, WRI, amongst other things, for example, actually creating a 3D map, let's say, of city of Mumbai, to say where are flood risk, where are the areas prone to flood risk. What that does is it actually very visually and very obviously shows, the low-lying areas, the highly, densely settled areas, where can runways get affected near the airport. So in a sense, technology actually giving very sharp and very clear insights on where problems can be. And I feel like, therefore, there's a very, big moment in using a technology of all kinds, particularly geospatial, to really improve on governance in cities, because you can get high resolution data to help you there. And therefore, the very last point I would like to make, again, related to technology and communities, is that I think the time has come, and the pandemic has kind of highlighted that community action and engagement is critical, both in terms of accessing as well as demanding access for services. I think it's a two-way street. I think it's an important time for that. And again, talking about the tech backbones that ULBs have, they've also built in a grievance redressal, system into that. And I think the good news is, if we can work with local community leaders, local organizations, to actually use those tech backbones, which can transparently pick up information about what services are missing, at least it's a first step to resolving the problem. And I am a firm believer that if you want to solve something, know something first. And I think like a combination of technology and data is making that happen. Let me pause here.
In fact, you really saying is that these technologies are helping us deliver the science of cities in some sense, to make the city itself a sort of from the social sciences to the physical sciences and the atmospheric sciences. And it helps us to deliver that scientific knowledge in a more usable way, which is really wonderful. Before I turn to Mr. Khan, I want to actually go back to Mr. Chatterjee with a provocation, Mr. Chatterjee, if I may, because what Shilpa has just described from the technology aspect, from the community engagement aspect, to the issues of equity, as she talked about, in terms of dense labor markets. You yourself said that the integrated planning has to bring economic planning and spatial physical planning together. The $1 million question in my mind is, who integrates? Is it the planner? Because the planner is actually guided by a fairly sort of what I might say a straitjacket in terms of its planning sort of guidelines, and it's almost a dogma. The administrator may not have planning knowledge per se in terms of making master plans and so on. How does integration actually take place, or who integrates? If you could share with us a few thoughts on that.
I believe it's a team led by the administrator. The administrator will actually have to get technical input from the planner. However, the administrator will have to guide. Now, I'll give you an example as to what happened for the first time in the development plan of Mumbai. For the first time, certain large chunks of land, which in 1991 development plan was land where infrastructure was not available, they were put in the no development zone. In the current plan, an assessment was made as to how much of this has been now accessible with infrastructure, and how do we bring this land back. While we are bringing this land back, why don't we actually, rather than only planning the land use to say that this much will go in residential and this spaces, why should we not say that this residential is meant for affordable residential? For the first time, a concept of an affordable thing was introduced. So this is obviously came from the administrator or a team which was helped by an outside expert. And the planner started working on that, and it has been provided. So it remains to be seen how it gets implemented on the ground. But for the first time, if this concept has now sunk in, that you cannot just mark certain portions of the land as red and say this is residential, then you only have unaffordable housing in lakhs which lie unoccupied. But then there are these slums where people have to now stay there and not being able to own slums, stay in the mezzanine floor and rental. So if you are able to create and bring back this land into the city and then earmark them only for the poor in the form of residential, which will be affordable, even including affordable rental housing, I think we are moving towards a solution. That's the point.
Thank you. Let me move to Mr. Moniz Khan. Moniz, TCPO is, as Mr. Chatterjee said, it's the administrator that has to bring the team together to do this integration. You work with the TCPO, and that's a subordinate organization of the ministry, and you are actually contributing your knowledge that you pick up from looking at planning regulations in practice, as well as using GIS to inform. Could you share with us perhaps an example of ways in which you've seen this integrated thinking actually working in the deliberations that TCPO might be involved in? Moniz, over to you.
Thank you, Professor Jagansha. It's my great. I'm really happy to share my experience. I think being a professional town planner, I should not leave any chance to speak on urban planning in such a wonderful gathering. I'll take a few minutes. I'll be talking about one national level program of formulation of GIS based master plan under Amrut Mission, and satisfy the concern raised by Professor Mr. Gotham Chatterjee regarding the master plan, and Madam Shilpa Kumar for use of geospatial technology. So the as you may be aware that there are 11 reforms under Amrut. So under the reform of urban planning, On the direction of the cabinet secretariat, we have designed one program, sub-scheme under Amrut Mission, we call sub-scheme on formulation of GIS-based master. This scheme is targeting 500 Amrut cities. It has three major components. The first is creation of base map using very high resolution satellite images, zero point 0.5 meter resolution. At 1:4000 scale, we have designed one. We have prepared one design standard document. Based on that, this document, believe me, it's very much in detail. Each and every feature has been captured. How the maps once the base maps created, we go to the ground, we collect each and every attribute of each and every parcel on the ground. We wait the maps and then come back, and then the final base map created for formulation of GIS based master plan. The second component under the scheme is formulation of master plan as per their state town planning act. And third is capacity building. There we have are organizing training as this technology is new and our town planning departments are not very much familiar. So we try to give some knowledge, or we try to organize the training on the subjects. uh, uh, the methodology of this scheme basically comprises of components, like one is a base map and second is a master plan. So as I told you, that is a start from the demarcation of mapping area, then acquisition of satellite images, GPS survey, geo-referencing, and then each and every feature extracted, then we do the ground truthing and then submit back to mapping agency, then they deliver the final base map, and we use using that base map primary and secondary survey, some socioeconomic data collection, identification of issues and potential, and then we do the projected requirements, policy formulation, a draft master plan, and the final master plan. So this is the first attempt that government of India has introduced any program, or the government of India is providing funding for such program. So this scheme has a funding of 515 crores. 115 crore is for mapping and 388 crores for plan formulation, around 11 crore for capacity building. We are giving 1 crore for each metro city and for 75 lakh rupees for class 1 cities for formulation of master plan. And apart from this, we are also for funding for base map creation and a capacity building. So there are some implementation mechanism at the state level. There is a consultancy evaluation review committee, then a state level technical committee, then a state level high power steering committee at the chairmanship of chief secretary of the state. And then we have some technical committees, apex committees at the central level. As on date, ministry has approved 412 crores, and out of that 130 crores has been released. Physical progress, which is very important. 412 towns have created the draft maps, and they are on the ground for waiting. And 256 towns have completed this field verification, which is very tedious job, and we took a lot of time in it because it's a very tedious and typical process to do it. It takes some time to understand. Now we are coming up, and we are completing this task also. And then the final base map is ready for 185 towns. And using this final base map, 123 draft master plan is ready, and 64 final master plan is ready. And under the capacity building program, we organized 48 training programs. 1,462 people have been trained. Uh,
That's
uh,
fantastic.
uh,
Um,
yeah, and thus I'm just finishing off that. This will be useful. Like it can be help to accurate and faster way of master plan for formulation, easy updation of your base map, monitoring and implementation of urban development projects, and it can be used in OBPS. But there were some issues we are just coming up, like there was slow progress for geodatabase creation. There was a slow progress for field verification, and there was some slow progress for awarding the contracts. Now, what about now states has asked, what about the non-AMRUT towns? AMRUT towns basically targets 500 class 1 cities, 1 lakh and above. Now, recently we have come up with another design standard document for formulation of GIS-based master plan for small and medium town using drone technology. There we are proposing one is mapping at 1:1000 scale that can also be used for site planning, zonal planning, layout planning, property tax collection, and all. So I hope somehow I have addressed the concern raised by Mr. Chatterjee and Mrs. Shilpa Kumar.
Thanks,
What do
Manish.
you
Thanks. You
say?
certainly have, because in a sense you've described to us what is the datum with which we're working. I mean, essentially these numbers of master plans being prepared and so on. Let me just draw us now to a close. I don't see too many questions in the Q&A bar. So if I may just address a closing question to Mr. Chatterjee, and a very quick reflection from your side. We have, of course, talked a lot about integrated urban planning, but we haven't actually addressed one key aspect here. How does it relate to the handling of the pandemic in the future? How do we actually build systems that are able to make us more resilient in the future? Any closing thoughts from your side? Just a very quick minute. I'm very conscious that we have to close the session. On preparing ourselves for future pandemics, I'm told that we should be prepared for a number of them.
Learning the lessons that we learned from this pandemic is where this vulnerable community in the city was left at the mercy of nobody. In fact, they will have to just walk miles, or maybe if they get a transport, then they will move out of the city and go elsewhere. If suppose there was a decent living condition for them, then this whole surge of people trying to move out would not have happened. If there were spaces earmarked for them where they could actually continue to earn their livelihood. Because even in the lockdown, we had the essential commodities were to be kept open. And most of these people, being vegetable vendors or any other things, now because they had no other space earmarked for them in the city. So essentially the city also belongs to them. They will have to be given that adequate space where they can live and also earn their living. And that has to be an affordable space. They should not have to rely on the market for that. Now that thinking has to come into the integrated master planning, and I think we should be better prepared for any pandemic in the future.
Thank you very much. So we should add a qualifier to our issue of equity. It's spatial equity. Very importantly, we need to build spatial equity into our planning and government systems, and the reforms that Muni's also talked about. I think what you mentioned about earlier about the affordable residential sort of allocation of land for affordable residential housing, I believe Brazil and some cities in Brazil are already experimenting with that, reserving land for affordable housing. So perhaps we can learn some lessons as well from other countries like Brazil. But
Bhagavato asks whether this is integration is rocket science. Certainly it's not rocket science. It's only your mindset, whether you can consider these vulnerable group to be part of the city. Does the city belong to them also? And if it, then in your planning perspective, you have to keep them in the forefront. It's as simple as that.
Thank you very much. I'm going to give Shilpa actually the last word. Shilpa, can I just come to you for a quick reflection on the building back better and the resilience aspect? How, for instance, the 3 A's that Mr. Chatterjee spelled out and the 3 D's that you spelled out, how can the twain meet? And is urban planning one of the ways it can do that? Over to you, Shilpa.
No, thanks for that, Jayan. And I think, in the end, the people who power our cities, who power our growth, it's almost 50% of the city in terms of population, and living in spaces which are a fraction of the city space. So I think the whole idea of, equitable cities will make us more resilient cities. And I think that's really what we need to focus on.
Thanks very much, Shilpa. So Shubhakoto, equitable cities, not rocket science, clearly. So I'm going to hand back to you. Thanks very much to our panelists, Mr. Khan, Shilpa, and Mr. Chatterjee, for sharing your reflections on the outcomes of this study. Back to you, Shubhakoto.
Thank you very much, Jagan. Thank you very much, Shilpa, Monis, Mr. Chatterjee. That was a very interesting panel. We will try and relook at some of the recommendations on the integrated planning stuff to see whether we need to fine tune some of those recommendations. Thank you so much for this well-spent hour. I'll now request, thank you, Jagan, also for handling this panel. You are best placed to understand both the planning and the development aspects of our cities. So thank you so much for this. I'll now like to invite Dr. Mukhopadhyay Partho to come on board and invite his panel to Partho. Partho, you're on mute.
Right. Good evening, and thank you very much for that quick transition, Shubhakoto. I was barely catching my breath from the previous discussion. So we'll move quickly into the next panel. I will do just a quick check to see that my panelists are here. I see Dr. Daksha Shah here, Dr. Rajiv Dasgupta and Sabina Diwan, and one would be expecting Ranjana Das in place. And we had Dr. Salunke call in sick for reasons very related to our discussions this evening. And we wish him a quick and rapid recovery. So the way we'll work this next hour or so is try and focus on lessons on urban governance that come out of lives and livelihood. That's the plan as of now, and which sort of gel relatively well with the outcomes of the previous panel focusing on resilience. The first two presentations will be by Dr. Rajiv Dasgupta and Dr. Sabina Diwan. Sabina will focus on the livelihoods aspect, and Rajiv will focus on the life aspect. And then it will give us a short reprise of is there an echo coming in? I'm just sort of, I'm getting an echo on mine. I'm not really sure whether that is true for the other thing also.
Yes, Partho, there's an echo. Are you on two devices by any chance?
I'll just check whether the other device is on. Let me see. Is this better now?
Yes, much better.
Wonderful. Sorry, I knew there was something wrong. So if one, which would be a reprise of the larger presentation, but focused on the issue of livelihood and livelihoods that Shubhakoto presented in the morning. And then we'll move into discussion with Dr. Shah, who's been managing the pandemic in Mumbai, and we're incredibly grateful for her to be here this evening. And with Ranjana, who's been also engaged quite intensively with the pandemic at Oxfam. So, and then hopefully a broader panel discussion, and please keep the questions coming into the chat box so that we can get back to them towards the end of the panel. So let me begin by asking Dr. Rajiv Dasgupta to begin the discussion. Dr. Rajiv Dasgupta is an epidemiologist. He's a medical doctor, he's a public health specialist, and incredibly involved within government, currently a member of the National EFI Committee, and consequently very well positioned to offer a perspective not only from the point of view of the study, but essentially also mediated through his own personal experience, which is considerable, and in fact, very much located within an urban metropolis, which is Delhi. So, Rajiv, over to you. You have speak for about 5 to 7. We have a little bit more time now, so maybe about 7 to 8 minutes, and then we'll move to Sabina. Thank you.
Thank you very much, and thanks to all my team members and the excellent support from from CPR, as well as the excellent support from all the study sites. I shall limit myself to certainly within 10 minutes to give you a broad overview. These are the heads under which we dealt with public health, which also includes clinical care. I shall briefly go through each of these. Are the slides visible? I hope so.
Yes, they are.
Okay, thank you. Okay. Essentially, what we have in black, I won't go into the details of these. What we have in the black is the evidence that's come both from a review of existing documents, the immediate review, as well as the primary work. So in some cases, this also includes quotes or the representative quotes. And the one in the green are the recommendations that emanate from these findings. So the first one we are
Rajiv,
looking into
you can go to slideshow mode if you can, otherwise you're fine. It's large enough, but
okay.
Yes, perfect.
Thank you. Thank you. Thank you. So the one in the green is really the recommendation and what we would like to draw your attention to. The evidence, of course, is present in the detailed report. So in terms of investment, what we unequivocally recommend is the need to increase health expenditure as a percentage of national budgets towards realizing an effective public health system, and to systematically upgrade the capacity of both infrastructure and human resources to the prescribed WHO standards that's taken as the broad goal. And also, we recognize the urgent need to invest in centers of healthcare and healthcare training, because that indeed emerged as a key focus area to ensure preparedness for public health emergencies. So despite all the support from the Disaster Management Act, from the center, state, and local body apparatus, what has been key to the response, and particularly when we use a comparative lens across some of these states and study sites, is the preparedness for public health emergencies, and therefore we are calling for an investment to that effect. In terms of the clinical care institutions, the overwhelming evidence is states with better primary healthcare systems, and a good example is Kerala, for example. Another good example is Maharashtra. These have been, which is quite aside from how many cases they had, that's not really the marker. That the primary healthcare system's preparedness has been a crucial factor. And also that we channelize the resources and systematic plans to be in place for increased and conversion of, as the response strategies for this particular epidemic goes, testing, early case detection, treatment, including preparation of intensive care units, etc. The issue of quarantine, of course, is very crucial, both at institutional and individual levels. The other notable lesson is the innovations in the public-private partnership. We will not go into the details, but there has been umpteen innovations, and as Shubhagata highlighted in his initial presentation, preparedness is certainly human resources, and this is a recurring theme we will see across the presentation. So one, of course, is to increase the workforce to manage public health emergencies. This did evoke a multi-pronged response from across cadres in all the states and local bodies. That's been a notable finding. And equally crucial is the role that frontline health workers played. And therefore, our recommendation is that with increased workload, there's a need to increase and review the remuneration along with boosting morale of the frontline health workers. We know that ASHAs, ANMs, and Anganwadi workers across states have given sterling support to this. But what's also needed is the retraining and upskilling of these cadres. The other crucial issue has been our finding on outreach services. The outreach services are crucial in order to have a more decentralized response. There are serious limitations of generalized lockdowns, and now as we are witnessing a second surge in many states, perhaps there's one consensus that generalized lockdowns will not possibly witness any more generalized lockdowns, but far more tailored, localized strategies. Of course, with hindsight, we are now a lot wiser, systems are a lot more in place, and therefore, this is not to make comparisons, but essentially to draw upon those lessons. The other crucial factor, and again, some states or sites have been better at this than others, is strengthening the epidemiological services, including the lab support. So a lot of these testing facilities, the tracing activities were almost built up from scratch. India and indeed the states and the cities responded admirably, scaling up capacities, ramping up production, imports wherever it was required. So it has been a huge learning phase, and today we are certainly a lot better placed than what we were exactly a year ago when the epidemic started. And this study essentially reviews some of the earlier phases of the epidemic or the pandemic when things were certainly relatively on shaky grounds. But we learned fast. Most states have shown tremendous resilience and therefore built often from scratch. But then other states were better placed in terms of epidemiological services. So disease surveillance systems, wherever they existed, responded better. But now all states have more or less streamlined, and it's a lot more robust and reliable than earlier. So those are the positive learnings. Mental health, of course, has received a lot of attention, but on the ground, particularly in smaller towns, they certainly remain an issue of concern yet, and this is something on which not enough attention has been paid, and we should be making these corrections. The financial and health risk mitigation is an important issue. The insurance cover has been an important finding. Awareness has been rather patchy, and these various central and state schemes, including its interaction with the private sector, there has been a lot of learning. So the key recommendations are insurance cover for all, especially the frontline health workers, standardized healthcare charges for testing and treatment with subsidy to vulnerable groups. Again, some states have done better than others. We have seen a whole lot of technology being used in this epidemic, and a host of innovations in the technology, particularly apps and electronic and application of electronic databases. So they have been used in surveillance, some of them quite innovative. Many states responded pretty fast on those. Some didn't work that well also. And equally important is being able to provide access to information. And based on our findings, the recommendations are: one, to provide access to easily understandable, local, contextual, COVID-specific information. Second, to check on rumors and misinformation about the impact of COVID that can lead to creation of fear among people. And there are umpteen examples, and this continues to remain a challenge now, even with the vaccination program. Third, and linked to this, defective use of IEC for creating public health awareness. And fourth, inequities exhibited for the differently abled persons during preparedness with respect to awareness, access to information, and access to general healthcare services. Again, this has been a global concern, but the experience in India is quite patchy. I shall skip this. We have spoken about data, information management, and access to information. Two key issues here. One, of course, is promoting citizen science through public participation and collaboration in data monitoring efforts and feedback mechanisms. This is going to be crucial as we move more and more into localized response strategies. And linked to this are legal frameworks that must prioritize transparency by establishing what information about individuals is sought to be collected and establishing a legal obligation to only use such information within the public health system. This has again been, there's again been a whole lot of discourse on this, particularly in connection to the apps. The strengthening through the local governance, particularly the urban local bodies. Till this date, this pandemic in India has largely remained, if not exclusively, almost an urban and peri-urban phenomenon. And therefore, the key recommendations are accentuating decentralization, vertical and horizontal through local governance, creating frameworks for greater community oversight and involvement, both in management as well as procurement and distribution. Third, expanding outreach services to provide home and community-based care through deployment of extension workers. And fourth, fostering partnership with private sector and civil society organizations to regain trust. I'll skip this. And finally, on capacitating frontline health workers, because that's crucial as we see the next level of surges, plus the fact that this vaccination campaign has to be sustained over long periods, and these would be repeated campaigns because none of these vaccines are going to provide lifelong immunity. On the other hand, we don't even know how long these immunities will last. Therefore, a range of recommendations, I won't go into the individual ones, on capacitating frontline health workers, who we believe are going to play an extremely crucial role as we move along in this process. Thank you. I'll stop here and we'll be happy to answer questions later. Thank you. Over to Partha.
Thank you, Rajiv. That was extensive but brief and with much to mull over, and will provide a good basis for the discussion as we go forward. Sabina, may I now turn to you for a similar overview on the livelihoods issue, and of course, your broader comments on the issue of livelihood management and our learnings about livelihoods that we can take forward for urban governance. Thank you.
Great. Thank you so much, Partha. And I want to start by congratulating my colleagues at CPR that led this really timely study on the critical issue of how equipped urban governance and planning are to manage the impact of the current pandemic. But I also want to, before I get into the livelihoods piece, quickly draw attention to three aspects of the study that I think are particularly unique. First, it deployed a mixed methods approach, not only relied on academic literature and data, but also complemented this with qualitative interviews, which were conducted, some of which were conducted in person, even during these trying times, which I think captured in a more nuanced way how people and local governments were experiencing the pandemic. And of course, this has very huge implications for us in terms of understanding the livelihoods impact that the pandemic has had. Second, the study was temporally dynamic. And what I mean by that is that it looked at experiences from past pandemics, the impact of this one, and looked at what must happen in terms of urban planning and governance to bolster recovery and resilience in the future. Again, the past, present, and future lens is extremely important when we're talking about livelihoods. And third, of course, the study also took a multidisciplinary approach, looking at the nexus of public health, water and sanitation, housing, livelihoods and social protection, all of which actually have a huge impact on determining how the other plays out. So, just a shout out to the colleagues that really took this very interesting and I think different approach and bit off a really large, took a really large bite in what is often dealt in an issue that is often dealt in silos. So now to go specifically into the livelihoods and social protection piece. The first point I want to make is that India had an ailing labor market even prior to the pandemic. So there was an uptick in unemployment. 1 out of 2 people were participating in the labor market, and fewer than 1 in 4 women were participating in the labor market. We all know that female labor force participation was declining. All of this before the pandemic. Non-farm informal employment, which is very broadly defined as employment that doesn't provide social security benefits and that is beyond the purview of labor market regulation. This kind of non-farm informal employment was stubbornly high at about 83%. And 71% of regular wage workers did not have a written contract. Now, this kind of precarity existed in our labor market prior to the pandemic, and it points to very large structural and systemic problems that the pandemic then exacerbated. This growing precarity in dense urban labor markets is well documented. I mean, the PLFS, all the data that I cited is from the periodic labor force surveys that were released in 2017, 2018. And the point that I want to make is that these large structural and systemic problems that our labor market was confronting prior to the pandemic have millions of workers, including the 174 million internal migrants. And this is based on Census 2011 data, right? That's the last estimate of internal migrants that we have that is even, that exists. And leaving these workers extremely vulnerable to job losses and wage cuts, fighting for basic survival. So addressing these problems requires a sustained effort. These problems cannot be addressed in the context of a short-term emergency response. And building resilience in livelihoods and socioeconomic welfare calls for making big structural changes needed to address these kinds of labor market woes. So the study actually delves into specific things that need to happen that cannot happen in the context of a short-term emergency response, but need to happen, at different levels of government, from the central, state, district, down to the local, even city levels, looking at, things like instituting better social security provisions, starting with the most vulnerable, collecting better data on labor mobility and migration, strengthening not just labor protections, but also their implementation, and instituting some form of coherence across states. Reforming our skills ecosystem. We just heard Dr. Dasgupta talk about the need for better training for frontline health workers, but this kind of reform of the broader skills ecosystem also needs to be addressed to have an overall better functioning labor market. We've also heard already through prior speakers about the need to strengthen transportation systems and housing. And both of these are fundamental to enabling the proximity and access that workers have to work sites, and these aspects need to be taken into account from a livelihoods lens when we're doing spatial planning. So we need to prioritize reform and governance of our labor markets so that we can recover and rebuild with true resilience in the aftermath of this disaster or any future disasters. And again, addressing these problems require sustained effort. They cannot be addressed in the short term, in the context of a short-term emergency response. That's point number one. The second point I want to make is that the study really shed light on the fact that livelihoods were largely neglected in governance, especially in urban and local response in the immediate aftermath of the pandemic. So one might ask, why? Why is that the case? other than the fact that I just got done saying how we've actually, for a lack of a better word, ignored many of our labor market challenges, or at least not given them sufficient priority, and are seeing an ailing labor market already. It's also the fact that local governments were more focused, perhaps rightly so, on setting up relief centers and quarantine facilities, et cetera, and livelihoods were an afterthought. So much so that we instituted the lockdown without really thinking through how our casual laborers, our self-employed workers, that together constitute over 50% of our urban workforce, many of whom rely on a daily wage for survival, would not be able to provide for themselves and their families. So where we have such a large share of the population that is in informal employment beyond the purview of regulation and or that are self-employed, then governance, be it at the central, state, local levels, has limited leverage. There's only so much you can do. And so perhaps one reason for why there was this lack of attention to the livelihoods question, which was clearly an important question to pay attention to during the immediate aftermath of the pandemic, was something that was not the top priority, partly because there's limited leverage. So for governance to respond to unforeseen, unprecedented emergencies like COVID, we need to strengthen the reach and efficacy to make a difference through policies and regulations, right? This comes through formalizing the informal. This comes through universalizing and strengthening labor laws, not weakening them. But ultimately, it also calls for better coherence between these efforts at the central level and how labor market woes are addressed at the state, district, and city levels. And better capacity building as far as livelihoods are concerned, especially at local levels of governance. We had some examples. So point number 3 is that we had some examples of measures like Odisha's special vending zones for street vendors that offer small-scale examples of livelihoods interventions that were instituted right after the pandemic hit that worked. And we definitely need to be able to document best practices, but these are extremely important, but not nearly enough. We need the broad kind of systemic changes. We need to translate those changes through capacity building and coherence through various levels of governance. The final thought that I want to leave you with is the what now. So the pandemic has led to the closure of, we know, a large number of small and medium enterprises. Some estimates suggest upwards of 35%. We also know, based on the data from the Center for Monitoring Indian Economy, that there's much higher levels of unemployment now. 1 in 10 people are unemployed. Youth unemployment is 3 times that. Female labor force participation rates have gone down even further. And as we have fewer regular wage jobs and fewer formal jobs, our already saturated urban labor markets are going to see even more downward pressure on jobs and working conditions. And so this makes the case and underscores the importance of thinking through really in a very deep way, how do we address some of these big structural challenges? How do we ensure that there's coherence across different levels of government and governance? And how do we build the capacity from a livelihoods lens to really be able to rebuild, to recover, rebuild, and then have resilience in a post-pandemic world? So I'll stop there for now. Thank you, Partha.
Thank you, Sabina. Let me now quickly move to Dr. Daksha Shah. Shah has been, I've been sort of, in order to save time, I've been posting the bios of the speakers in the chat box. So those of you who are interested, welcome to use them. Dr. Shah has been at the center of fighting the pandemic in Mumbai as the Deputy Chief Officer of Health in Mumbai. But she's also a very accomplished public health scholar. But for today, I would request her to respond in a sense first to the two quick presentations by Rajiv and Sabina, and also to perhaps point out the manner in which it was possible for Mumbai to respond and respond relatively quickly to what were significant challenges in managing a pandemic in a city like Mumbai. When you look at megalopolises around the world with much lower levels of density, I think the manner in which Mumbai has come out of the pandemic, or rather, perhaps those are early words, is truly something to think about. Dr. Shah, if you can focus on, as I said, the manner in which science was able to work with administration to craft a response, as you talk about your work in Mumbai. Thank you.
Thank you, Parth. I think that was the relevant question. Let me first begin with thanking the team, all the three organizations, for having me on this panel. And also, I would like to congratulate the entire team for this excellent report and the key recommendations which are put into a nutshell. And again, I would like to thank my co-panelists for bringing on the points. Now, if I have a comment on the points which has been made by Rajiv and Sabina both, I think that Rajiv has made most of the points which is relevant to the COVID-19 pandemic response, which has been mounted by most of the cities, the states, and the towns. I think similar response we have mounted in Mumbai. And I would just like to make a small correction by saying that I have not led the response, but I have been the part of the team and have led some few of the teams, working in the municipal corporation, and especially from the public health department point of view. Having said so, let me tell that how we began in Mumbai is like in last March. So this pandemic has taught us many things. It has showed us our strengths and our capacity to rapidly respond to such emergencies. But at the same time, it has exposed us to our insufficiencies and unpreparedness in so many other things. I would say that there were many challenges, but as it came, we overcame those challenges. So to begin with, I think in the month of March, when the few cases were reported at that time, I remember the first stakeholder meetings, which was convened by the Honorable Commissioner, and there was a multi-stakeholder in real sense. People from all walks of life were there, and I think that was a plan which was talked out there, and the responsibilities were fixed. After that, there was this Epidemic Act and the Disaster Management Act, which was revoked. We have this disaster management cell in Mumbai, and there is this emergency support functions which has been activated. It worked 24/7. There was a war room which was established. And then rapidly, there were all action plans which was put into place. Like in terms of expansion of infrastructures, as we all know, initially the beds were very less. We were not knowing much about the disease and how it was going to progress. So it was important to build up those capacities in a very short period of time. And I have actually experienced like how to coordinate and how to rapidly, put the teams into place and get the things done in a pandemic situation. So I think that's a totally kind of an experience. We have built up our lab capacity from starting from just one lab to almost 33 labs now, and we have outsourced also many of the lab tests. In addition to that, all the lab infrastructures, we have this beds management strategy where we have first expanded our own municipal beds. From say starting from 100 beds, we have gone to 3,000, and now we have 12,000 beds in all our isolation centers. Ventilators, ICUs, oxygen beds, and the ambulances all were rapidly expanded from say some numbers to this. And this whole planning was done based on the data which we were collecting. We used the artificial intelligence and the data management units and the consultants who helped us to have the projections, and also some modeling were used to anticipate and to forecast the number of cases in the next 15 days, and we would plan our beds accordingly. Central to this all was the HR. It was the biggest challenge to get HR in place because there was restrictions, there was lockdown, the staff were not able to travel, and also there was a lot of fear and stigma even among the hospital staffs. I remember, many calls from the private hospitals who were then like They want some kind of backup where they can take action on their staff who is not putting. So to HR strategies placed into place, there was rapid protection staff, there were remunerations, there were insurance given, lodging boarding facilities were given, and all the safety measures were also given to the staff, and the capacity was also built up. Now, this all required a lot of coordination among the different teams and the hospital teams. In addition to that, we also had this operations at the airport which was happening, and at the families. So these CBOs were of very big help. In addition, I would say there are special focus programs which we implemented. So one of them was Mission Saving Lives. I think you all will agree that in any pandemic, the focus is definitely to reduce the mortality rate. And as Mumbai had reported a lot of deaths, there was an urgent need. So we went into details of why the deaths were happening. And of course, we had charted out like what is the population and which is the age group which was reporting more deaths. It came out to be, of course, the NCD, that is the diabetes and hypertensive patient. So we started a survey of the senior citizens, house to house surveys. We involved our ASHA workers and CHPs to go house to house in the slum in the month of May itself. And we brought all those senior citizens who had low oxygen levels, who had temperatures to early referrals. In addition to that, we had set up these protocols, the medical and the non-medical protocols to be followed into the hospitals and the ICUs, where the senior doctors has to take meetings with the junior residents and the the doctors, and they have to take rounds and they have to guide individualized patient treatment, and you have to ensure that the treatment protocols are followed, because this was very crucial. All these new evidences and the treatment which was coming up, we had to ensure that those are available in the public hospitals. Now, in addition to this Mission Save Lives, I said that the general health services was getting very badly hit in terms of immunization services, the ANC services, and also the TB services. So our staff worked, I think, into the containment zones. The TB staff, they went in, they provided the medicines to the TB patients. We also had a special program for the dialysis patients, because I think the dialysis patients could not access the slots which is required for the dialysis. So rapidly, dashboard was created, Project Victory was created with the help of the nephrologists and the IIT people, and we could allot the slots to the patients. And in addition to that, we had these machines, which the dialysis machines, which was rapidly put up in all our corona centers, in the public sector as well as in the private sector hospitals. And this Project Victory, I think it brought down the urgent acute shortage of the dialysis beds into the corona positive patients. So there are many, many such projects which we took. The most important, I would say, is the bed management in the time of pandemic. There was acute shortage of beds, so we had to have multiple strategies. We have these war rooms which was activated. There are 24 wards in Mumbai. So we had the interns, the doctors, and the teachers who have been put into war rooms. They would triage the patients. They would decide which patient needs the admissions, and they will send the teams, check the patients, and then they will shift the patients in an ambulance. Now, all those asymptomatic patients who were sitting on the hospital beds, they were compulsorily be discharged and they were put into the home isolation. So certain legislation and certain, strict actions were required on the part of the leadership to take those decisions. Right now, also there is a standing instructions where the beds has to be vacated into the hospital. So these kind of local actions are required, like daily review and daily monitoring at every level. Like the senior most leaderships, our commissioners are involved, then our middle level managers are involved, and the field staff is also involved. There is continuous procurement of the stuff which is going on. So for that, the decentralization of powers and the financial powers are given to the local assistant commissioners and local DPs and the directors. So many, I would say the functions were going together. In addition, as I said, that there were these Mission Saving Life, which came much into focus. And after implementing those protocols, the medical and the non-medical protocols, we could bring down our case fatality rate below 2 right now. As I said that we had these house-to-house surveys, and we had mounted this big awareness campaign called My Family, My Responsibility campaign and No Mask, No Entry campaign, because it was very important that if you really keep telling people to use masks or, to have this corona behavior, a lot of people now are not, ready to listen, and they're all relaxed. So it was important to bring some kind of, punitive actions on the people who are not following your guidelines or not following your orders. And these were then, backed up by the Epidemic Act and the Disaster Management Act. Now, most of the points which has been made by Rajiv is there what is being implemented even in Mumbai and other cities as I see his presentations. I would like to just focus on 2-3 things that most important in the pandemic is the team building and the leadership. I think it's very important that every level there is a team and cohesiveness which has been prepared. Then the mental health issues of the healthcare staff and the frontline staff which has to be addressed, and the managerial capacities of the public health system. I think these are some of the broad, I would say, the support which is required currently in the recommendations, I would say. And I would also like to just conclude by saying that currently, since we are seeing the second wave, the challenges what we are facing is in terms of the HR basically, because right now most of our quarantine centers, the isolation beds has been activated. So we require a lot of doctors and the staff in those centers. Simultaneously, the vaccination big drive is going on. As we vaccinate more than 45,000 people in a single day, we have a lot of HR which has been roped into the vaccination drive. And now coming to the general health services, like we need the staff who has gone back to their routine health services, which we had drawn it, earlier for these corona care centers. So all these 3 operations going simultaneously, I think we have a lot of challenges as far as the staff management is concerned, procurement of staff is concerned. Though we are giving good remunerations and many support, it is always a challenge to get the staff, and we really feel stressed out because of this particular reason. Having said this, I would say that these are the implementation challenges, and I think it requires the checklist when we talk about this kind of reports and we talk about the resilience planning. I would just have my comments restricted that we should have involved the district officials into the disaster management plans, which I would say I hardly remember being involved in any of these disaster management plans. Especially the plans were focused on the slums, on the floods and the earthquake, etc. But such kind of enormous pandemic, I think there was better preparedness which was required. The second thing I would like to say is that we have to integrate this whole plan, whatever the recommendation, into NUHM. As we know that the NUHM is a bigger umbrella which provides most of the public health functions has been covered under the NUHM, and the strengthening of the primary health care centers as well as the CHCs are happening. So the disaster risk reduction plan and this functions of the pandemic and resilience, this has to be integrated into the NUHM plan and the district PIPs. And then strengthening the public health infrastructure in terms of the frontline workers and also the healthcare workers in terms of their remunerations, in terms of their safety, is an important aspect. And I think the center to all this is the financial allocations. The funds are required to run all these operations. So with this, I think short, insights, I would stop here and would like to also take some of the questions and the path we can interact on this.
Shah, if I can quickly ask to address one quick thing before I move to Ms. Das, is if you were to quickly summarize how having health as part of the Mumbai government's function vis-a-vis the government of Maharashtra, to what extent was it useful to have it as a municipal function versus it being a state function, which is the case in most other states of India?
I think the response of COVID in Mumbai is entirely the municipal function. Though we had the other authorities who were chipping in, like we had the police authorities, we had the MMRDA who was giving us the land to set up our COVID jumbo facilities and the field hospitals. So there was this coordination and multi-stakeholder involvement, multiple sector involvement. There were many NGOs and many CSR partners and the corporates who chipped into giving supports in But essentially the whole response was mounted by the municipal corporation, and there was this continuous dialogue, and there was this continuous coordination with the state government and the central government as well. And we followed most of the guidelines, but we amended a lot of guidelines at the local level. I can just give an example of, screening of the international passengers. Like most of the states and the government guidelines says that on arrival, if there is a negative report, the person is allowed to go home. But in Mumbai, we had like any UK passengers who come to Mumbai, even if they have the negative report, we are quarantining them in the hotels. On the 7th day, we are testing, and then we are allowing them to go. So this is being a little extra precautious, and we amended the guidelines. Even the testing guidelines we had amended. I remember in the month of May and June, we had amended many guidelines. So essentially, just to come back, it is the response of the municipal corporations in collaboration with so many other agencies which were working in the city that we were able to do so much.
Thank you. Ms. Das, if I can now turn to you to quickly focus on the issue of civil society and how it may have engaged with the administration. I mean, Dr. Shah already spoke about the involvement of civil society actors in essentially helping with management, especially in informal settlements. But obviously, this engagement has been widespread, but with extremely varied kind of outcomes in different situations. And with your extensive involvement both in the private sector as well as across taking a bird's eye view of the structures, how would you respond to that question? And of course, any responses that you might have to the remarks made by Rajiv and Sabina. Thank you.
Yeah, thank you, Dr. Mukherjee. It's been a pleasure to listen to all the panelists, and some of them are really technical and some of them are very academic and a good enriching learning for me as well. My intervention would be very brief from a CSO, civil society organization perspective. And last year, if some of us can remember, March 22nd was the day when Bihar first declared the lockdown. And I was at Bihar, Patna at that point of time, sort of trying and seeing what's happening. So civil society organization, as Dr. Shah rightly was pointing out, and some of our earlier panelists also had pointed out, did play a significant role during the lockdown. So one of the area when we started working as Oxfam, we figured out that there were few constraints for us. The first and foremost constraint was that Oxfam is a leading humanitarian organization. If there is any sort of disaster, say flood or earthquake, we are up there with our relief services, shelter services, because we are geared to do that, have our internal expertise. But with the lockdown and with the pandemic, there were certain logistical issues, which was like the mobility was restricted. We couldn't reach out to the communities. This is where our CSO network actually was very, very effective. So I still remember that in Patna, within 2 weeks' time, we were able to collaborate with our Right to Food network and do a survey of 18 slums across 6 wards to figure out to what extent the Dihari Mazdoor, the informal sector, lost their jobs. They're running without food, no medicine, no water, no health and hygiene conditions were really deplorable. And that actually helped us to start a relief work through the campaign network members who are actually community-based volunteers. So what we learned was that it's in the national disaster management area, there's this whole discussion that goes on to localize humanitarian, to localize to foster more and more local leadership. And I think during the pandemic, this has given us an immense learning that unless we build local leadership, it is very difficult to deal with a pandemic of such a tall order. So that's one of the areas. The second challenge, what we faced while we started working, we could do some of our food and supply distribution, because some of the local market was operating, but when it came to a mass distribution, we had to depend on cross-state essential service supplies. We couldn't initiate that until and unless the government was allowing us to do that. And here I would like to point out one of the challenges that civil society faced at that point of time and how we navigated that. Particularly Bihar government and a couple of other governments were actually didn't allow CSOs to do that for certain reasons also, because it was a lockdown period and there were also risks of people gathering during the distribution or so. So in that case, we actually collaborated with the local governance. So I remember in Madhubani and Sitamari, in municipality areas, we actually collaborated with the local municipality ward members, collaborated with local ward members to allow us to do the food distribution, because this was really required. So that's one of our learning, that while it is important to foster local leadership from a CSO side, it is also important to handhold with the local governance structure. And for an urban area, without actually hand-holding with the local ward members or the local corporators, as we call them in the Patna urban municipality areas, it was actually difficult for us to even do the supplies, essential supply distribution. So that was one. The second hiccup to do the awareness, and where we learned that this was a little difficult awareness generation because it required clinical understanding also. So some of the messages that had to be given in terms of quarantine, in terms of isolation, in terms of what is positive. So there we actually collaborated. I mean, in almost all the state, we have this interagency group where UNICEF and WHO are also members. So we actually followed their training manuals to do our awareness generation program in the remote pockets, which also included urban areas. But that also we had to do with a lot of restriction, that we don't gather people, because that was something which was not allowed at that point of time. So what we did was we did through mobile caravans, through vans, through miking, and so on and so forth. So that was also another collaboration with the local corporators. One of the things where civil society groups played a good role and where Oxfam took a lead was try and understand and allow me I mean, pretty much pandemic, nobody was actually talking about what women were facing inside the homes. So we started actually receiving phone calls from, Patna peri-urban areas, that one of our local partners actually say that a woman has been put on fire by her husband. So we say this was really a very trying situation. So we actually did a register of all the helpline numbers for all the 5 states where Oxfam has been active and tried local networks and supports. So those are some of the leading work that during the first, I would say 3 to 6 months of the pandemic, that Oxfam, local partners, local administration were able to do hand in hand together. There was no scope actually to do work in isolation. And I completely agree that when it comes to catering to urban areas, there was a lot of need to understand that people were losing jobs. The public distribution system was not working, even though the government had actually declared certain schemes, like Bihar government declared rupees 1,000 towards the ration, but almost 1.8 million Bihari Mazdoor didn't even have the ration card. So much was needed to be done in terms of food and civil supplies, but much is also now required to be done in terms of ensuring social security for the, particularly in the urban spaces where there are a lot of migrant workers and informal workers who come and reside over there. So you also asked me about the role of private sector. Well, for Oxfam, private sector, I mean, we have all seen that what was the plight of migrant laborers, how they were left to themselves when the companies didn't take their responsibilities. At the same time, Oxfam did receive a lot of relief support and PPE kit support from the private sector. Related to the PPE kit support, the State Health Society of Bihar really helped us. They issued the order to us so that we were able to actually supply PPE kits to the frontline workers for few of the districts and for Patna as well. For private sector, there have been a couple of interesting initiatives that actually started, and Oxfam is right now a part of it also. One is there is HCL Foundation, which started this initiative called COVID Academy, where UNICEF, WHO, few of the INGOs are now the technical partner to train the frontline workers on, I mean, at that point of time, we were doing series of training on do's and don'ts during the COVID period, the quarantine facilities, so on and so forth. So these are some of the initiatives that were organically coming out and which still would continue. And we are now seeing that whether we can take them through a long and in the state of Jharkhand, an interesting initiative that came up that under the Labor Ministry, the Jharkhand State Rural Livelihood Mission initiated an initiative in collaboration with the civil society organization Pan India to trace the migrant laborers who are walking back home or taking any sort of transport services to Jharkhand, to trace them in the, like we in Bihar, we in Patna and Gaya actually traced migrants coming from Delhi or Gurgaon or Noida and supported them with food and other medicines and other kind of support that they needed. So, but the point that I'm trying to say is that two things were our learning. One is, of course, collaboration is required. I don't think for such a pandemic, for us to survive such a pandemic, neither private sector alone, nor the CSOs, nor the government can do it all by themselves. There is a need for all of us to come together. Now, since we are discussing the urban setup and we've been talking a lot on technical aspects and governance, there is a need to look through the lens of social inclusion. Because if we are talking a lot on technological innovations, but it's also important to see, because urban area, I was a couple of weeks back, I was in Bangalore to do a scoping to initiate our urban informal sector work. We must realize that the urban areas are such areas where there is not much organized sector you would get. Mostly they are daily wage laborer or migrant workers. So if we are doing some kind of innovative urban planning, or if we are talking about governance reforms, it's very, very important that we take their voices under consideration. So that would be from my side. Representing Oxfam, happy to respond to any questions. Thank you.
Thank you, Ms. Dutt. So the way I see it, we don't seem to have too many questions, but there are, if anybody within the panelists would like to obviously ask each other, not just the ones who are on the current panel, but previous panels and also others. Please raise your hand and I'll recognize you. In the meantime, if I can just ask you to reflect quickly on three broad themes related to the two panels that have come out. The first is the importance of community in building resilience. And I think that it was Shilpa who sort of, among others, who sort of, mentioned that quite clearly. And I think that's a theme that's run through both the health as well as the livelihoods sector going forward. The second is, and two specific things, if I can just see any other structures going forward, is, and I'll come back to you, the panel for quick concluding remarks. But I would urge you to organize them to address two quick questions. One is with respect to health and livelihoods. To what extent do you think going forward engaging the local government as part of the core health response? And we heard Dr. Shah speak to the Mumbai experience. To what extent do you think that would be something that would add to the to the flexibility and rapidness of response going forward. And that is linked also to the other issue which came up both in the opening panel and otherwise about the involvement of the levels of the districts and larger cities as part of the disaster management plan. And the second is with respect to livelihoods and the extent to which cities can, in some sense, if you were to pick one action that a city can do to, in some sense, ensure some of the livelihoods that people have in these cities, what would that one action be? So, Dr. Dasgupta, if you can start with you first. If you were to sort of respond to these two questions, what would they be?
Artha, I missed the last part. Can you repeat, please?
Yeah, quickly with respect to the live story, I was asking about the extent to which localization or involvement of local governments, both in disaster management as well as in health administration, would be useful. And the second is with respect to livelihoods. If you want to pick one intervention that might have actually helped ensure some of the livelihoods in these urban areas, what would it be?
Well, I'll probably leave the livelihoods question to Sabina as the expert, but I would link to what Daksha said about the NUHM actually enlarging its ambit to address vulnerabilities, events and vulnerabilities such as this. In fact, what's crucially missing in the NUHM implementation, and it's only to varying degrees that a few cities and states have even attempted this, is actually to have a vulnerability mapping, and therefore actually tailoring and strategizing the services, and therefore bringing them into the bottoms-up planning and the PIP in line with this vulnerability assessment. And if anything, this pandemic has really underscored the necessity of that, and the fact that we didn't really have vulnerability maps, or at least effective vulnerability maps, I think is a lesson, and therefore this should also be taken as an opportunity for the NUHM to reinvent itself. NUHM didn't get much of a chance in most states and cities, but NUHM can also leapfrog into its next avatar and reinventing some of these things. Thank you.
Thank you, Sabina.
Sure, thank you. So I will also address the question about, to what extent, what is the one thing that cities can do to ensure livelihoods, and maybe zoom out a little and ask what can urban local bodies do on livelihoods. And here, I, of course, completely agree with Dr. Dasgupta that some kind of vulnerability mapping also in terms of the livelihoods impact of such situations would be a very useful tool. But I think broadly speaking, there's three areas where I think urban local bodies can make an impact. One is structure, both in terms of, as I already mentioned, enabling workers to have access and proximity to work sites, and also looking at how urban infrastructure can itself be an engine for job creation, and leveraging that opportunity are both ways that I think urban local bodies have a role to play. I also think that they're fundamental in terms of operationalization of policies like an urban employment guarantee scheme. And finally, we have, excuse me, examples of the stopgap measures like we saw in Odisha, where there were special vending zones for street vendors. So taking on, after you do the vulnerability mapping, looking at some of these stopgap emergency kinds of mechanisms that could be adopted would be the third thing. But I would also prioritize them as first public works and infrastructure, particularly transportation. Second would be operationalization of schemes that then have to, be crafted at the top central structural levels. So like an urban employment guarantee scheme, so helping operationalize that. And the third would be stopgap measures like the special vending zones that we saw in Orissa. So I'll stop there. Thank you.
Partha will quickly add half a minute. That this vulnerability assessment shouldn't be seen as a very technical mechanistic exercise. In fact, and that's what governments do best. And I speak for myself too. The point is that in this pandemic, we simply haven't invested enough in social behavioral research. And this is doubly ironic given the fact that from day one, the mainstays of preventive interventions were actually social behavioral, whether it's washing hands, physical distancing, etc., etc. But there has been zero investment in that. We do not have any behavioral survey. Of any validity and reliability to know what's really happening in terms of this, and more importantly, what risk perceptions are, what's shaping these behaviors, and so on. That's a bus we have completely missed, and there's a lot left to do because the pandemic isn't going anywhere. Thank you.
Thank you, Dr. Shah. And also with respect to the social behavioral thing that was just pointed out, I'm sure you're also grappling to some extent with vaccine hesitancy and vaccine anxiety. And that is something that perhaps you could also weave into your answer as you go forward. Dr. Shah, you're on mute.
Yeah, so as far as the vaccine is concerned, I think initially there was some resistance, but I think the most of what we are seeing is the response. Elderly more than 60 years are really coming forward to take vaccine. It is only the question between the Covaxin and the Covishield. There are a lot of queries coming, which is better, and people want that options. So now we have issued a press note saying that both are equally good. We have to convince people that whichever you go, whichever is available, you will have to take that. And also regarding the duration, I think today just now the ministry has issued a notification that the minimum between the two doses could be 6 to 8 weeks. For the Covishield. I think this kind of information has to go to the people, and you have to use our communication strategies very effectively. So if I have to just talk about the building resilience and in context of today's discussions, I would say that first of all, we all have to understand that what is that last person in the public health system or in the community understands by being resilient. So we have to define those in a very, very simplest form. We have to have a checklist of these are the things which defines that your health system or your health center is a resilient system. So I want to make that people, an ANM or an ASHA worker, to understand what is being resilient. And of course, then they will be able to explain it to the community. The second point I want to make over here is that engaging the private sector, we have still not tapped the potential of the private health sectors in terms of we have a lot of clinics, small nursing homes, hospitals. So can we have some kind of rate control? And we already have models in TB, like in Mumbai we had a very big PPIA, which was a successful model, which was then scaled up in the country, which I was doing. And in COVID also itself, we have engaged more than 40 to 50 hospitals, reserved their beds, and we have this 80-20 principle in which 80% of beds was governed by the public sector. So in the routine health services, in improving the access, can we use the private sector in a big way? And now it is time that we have to invest in collaborating with the private sector. Different models which is being recommended by the NITI Aayog can also be used, strengthening up our own. Every time there is no need to invest into our own health, the private sector also we can collaborate and we can have. The third point I want to make is involvement of the public representative also helped us a lot. I think these are the two crucial, players in terms of pandemic. I think convincing them, having a dialogue with them, and getting your point of view across to the citizens, and making building up the trust and the confidence of the people into a system is, I think, the most important part. So making the public representatives and the media as an essential part of our resilience building is also important. And the last but not the least is the community-based model. We have the successful model of Dharavi. We have the successful model of the Vali Kolivada, where the entire thing had gone into containment, and it was the local people who helped, like local practitioners, local CBOs, local public representatives. Everybody came together to help the patients, to set up camps and the mobile vans and all those things. So I think evolving the community-based model even within the city is important. Like in the city itself, the Dharavi is different for Kolivada. It is different from another slum, let's say in Govandi. So I think evolving the community-based model and making the community self-sufficient in terms of managing a emergency or a pandemic, I think it will go a long way if we can do something on this piece into the report.
Thank you. If you can just spend one more minute also to the question that's financial support, additional financial support that came into MCGM from the government, especially in the health sector. And any special, as you said, you're learning a lot as you go forward, but what did you learn about the other issue, which I think is also mentioned, about persons with disabilities? In terms of responding to persons with disabilities, is that something that the system learned to do better as it went forward, and what kind of responses might actually have to do that?
I think it's very correct that I think we have not been as inclusive as possible into our health plans. Let us be very honest about it. I think the people with the disability, I would say that it's not there in the plan. But yes, we made certain arrangements, and we get a lot of calls from people who are homebound, and those people with the stroke, people with the physical inability who would not visit the centers. So we had to arrange some home visits and home services also. So I think the outreach services and the home-based care also could be one of the part of the entire plan. I'm just missing your second question. One was on the finance, I guess.
Yes, exactly. The additional finance provided by the state government to the municipal government.
As if what I understand and I know is that most of the finances came from our own institution, that is the municipal corporation made most of the financial provisions. There were, budget provisions, the standing committee gave approval to a lot of budgets for the procurements, etc. What was important is leveraging the corporate social responsibilities. So we got a lot of partnerships through the CSR, and I remember I myself had mobilized so many ventilators and so many masks and sanitizers, because there are always people who wants to donate and they want to see that it goes into the right directions. So I think this kind of a model we need to like your own or the financial mechanisms, and then you plan to get the CSR support or the support from some organizations, and also some kind of finance generation. I'm not sure what I can comment on this, but I think most of the finances came from the local government, and there was for the NUHM programs, most of the support is coming from the government of India as well as the Maharashtra state NUHM body. So all of our NUHM is supported by them, but we would like to see more of capacity building through the NUHM because it's an umbrella project, and we look forward to that also.
Thank you. And Ms. Das, a final word from you as we wrap up the panel.
Yeah, so on the livelihood thing, and I completely agree with Sabina when she makes a point that we need to do a mapping. Of course, mapping of vulnerability, mapping of livelihood options available in an urban space. But also the other thing is we also need to do a mapping of opportunities within the urban areas, because most of the time livelihood initiatives are initiated, but without proper linkages with the market or a proper business opportunity, they don't survive. So that's one. And number two, there is an immense need of connecting people with the social security schemes and guarantees that are meant for them. So if these two are ensured properly, I mean, pandemic was the time when we have seen the most dangerous kind of labor law relaxations, and we are now getting the labor codes unfolded with the code on social security, code on wages, and so on and so forth. So it's immensely important that we generate awareness within the community about these legal provisions and their entitlements and rights. So not only interventions related to livelihood, it has to link with opportunities so that they sustain, and also within a framework of rights and entitlements should be a more sustainable way of approaching.
Thank you, Ms. Das. And with those words, can I hand back to Anindita to move to the closing session? Thank you.
Thank you.
Thank you so much for your really wonderful interventions.
Thank you, everyone. Thank you, all the panelists who were here and still here. We are past 6 minutes, the scheduled time. I'll just pass on to Sanjukta Roy to close the session. Before doing that, I'll take a minute to thank you all for being here from our side, and also to, we missed Mr. Rao, Rajeshwar Rao from Niti Aayog due to some urgent engagement of his, and also PSN Rao, Professor PSN Rao could not join. Those two are very we missed an opportunity for this discussion, but we surely look forward to take this report to Dr. Rao in Niti Aayog and, take him through the learnings in a separate setting along with our HCDO colleagues. So on that note, Sanjukta, over to you, and thank you all of you.
Thank you all of you. And on behalf of FCDO, I will like to thank our distinguished panelists and all attendees for this fascinating workshop today. It was great to see the seamless transition, rigorous analysis foray into actionable policy level deliberations. So for me, some of the key points to today's discussions will be the discussion on bringing in an urban risk framework into urban financing and strengthening municipal finance to enable localized action. The importance of integrated urban planning and how it relates to handling of pandemics in the future to make our cities more resilient, and the key leadership role that planners and administrators, particularly administrators, have to play. The concept of building equitable cities by creating decent living conditions and affordable spaces for the poor and disabled to allow them to live and earn a decent living, and make it all part of an integrated master planning process. The importance of civic tech and digital solutions to foster transparency and good governance, to foster out-of-the-box solutions and provision of localized solutions. The importance of bringing together all stakeholders like the private sector, CBOs, NGOs, along with government bodies, particularly in providing rapid solutions, be it managing vaccination drives, rising number of cases, etc. The critical importance of mapping out lives and livelihoods, opportunities and linking them with business market opportunities, and engaging and investing in vulnerability assessments and socio-economic behavioral aspects to connect people with social security schemes within a framework of rights and entitlements. And lastly and not the least, effective use of communication strategies to build resilience, particularly for the last mile, and making public representatives and media and essential part of this this entire building resilience and building back better discussions. So thank you again from all of us in FCDO and for the Center for Policy Research. Thank you very much for your time, all of you.
Thank you. Bye.